Hey Alpha Nurses, I'm Licensure from alphanursguy.com. This is 250 practice NCLEX questions. Without delay, let's get started.
A client is admitted to the recovery room after cystoscopy with biopsy. Before the nurse can discharge the client, the nurse should be sure the client 1. Has a bowel movement. 2. Has received the first dose of pain medication. 3. Has voided. 4. Has no blood in the urine. The correct answer is 3. Has voided. The nurse should verify that the client has voided prior to discharge in order to evaluate bladder function. Bowel function is not expected to be affected by this procedure. There may not be a need for pain medication immediately post-procedure and before discharge, but the nurse should assess the client's pain status and inform the client about the use and side effects of the medication. It is normal for the client to have hematuria because of the procedure. A client has undergone a cystectomy and an ileal conduit diversion. What should the nurse incorporate into the discharge instructions? Select all that apply. 1. Drink at least 3,000 milliliters of fluid each day. 2. Minimize daily activities. 3. Keep urine alkaline to prevent urinary tract infections. 4. Avoid odor-producing foods, such as onions, fish, eggs, and cheese. 5. Wear snug clothing over the stoma to encourage urine flow into the drainage bag. The correct answers are 1. Drink at least 3,000 milliliters of fluid each day, and 4. Avoid odor-producing foods, such as onions, fish, eggs, and cheese. An adequate fluid intake aids in the prevention of urinary calculi and infection. Odor-producing foods can produce offensive odors that may impact the client's lifestyle and relationships. Lack of activity leads to urinary stasis, which promotes urinary calculi development and infection. Acidic urine helps prevent urinary tract infections. Tight clothing over the stoma obstructs blood circulation and urine flow. The nurse is instructing the client with hypothyroidism who takes levothyroxine 100 micrograms, digoxin, and simvastatin. Teaching regarding medications is effective if the client will take 1. Synthroid with breakfast and the other medications after breakfast. 2. Synthroid before breakfast and the other medications 4 hours later. 3. All medications together 1 hour after eating breakfast. 4. All medications before going to bed. The correct answer is 2. Synthroid before breakfast and the other medications 4 hours later. Synthroid must be given at the same time each day on an empty stomach, preferably 30 minutes to 1 hour before breakfast. Other medications may impair the action of levothyroxine absorption. The client should separate doses of other medications by 4 to 5 hours. The nurse should assess a client with hypothyroidism for which of the following? 1. Corneal abrasion due to inability to close the eyelids. 2. Weight loss due to hypermetabolism. 3. Fluid loss due to diarrhea. 4. Decreased activity due to fatigue. The correct answer is 4. Decreased activity due to fatigue. A major problem for people with hypothyroidism is fatigue. Other signs and symptoms include lethargy, personality changes, generalized edema, impaired memory, slowed speech, cold intolerance, dry skin, muscle weakness, constipation, weight gain, and hair loss. Incomplete closure of the eyelids, hypermetabolism, and diarrhea are associated with hyperthyroidism. Which of the following medications should be available to provide emergency treatment if a client develops tetany after a subtotal thyroidectomy? 1. Sodium phosphate. 2. Calcium gluconate. 3. Ecothiopate iodide. 4. Sodium bicarbonate. The correct answer is 2. Calcium gluconate. The client with tetany is suffering from hypocalcemia, which is treated by administering an IV preparation of calcium, such as calcium gluconate or calcium chloride. Oral calcium is then necessary until normal parathyroid function returns. Sodium phosphate is a laxative. Ecothiopate iodide is an eye preparation used as a miotic for an anti-glaucoma effect. Sodium bicarbonate is a potent systemic antacid. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client who has undergone a subtotal thyroidectomy is subject to complications in the first 48 hours after surgery. The nurse should obtain and keep at the bedside equipment to 1. Begin total parenteral nutrition. 2. Start a cut-down infusion. 3. Administer tube feedings. 4. Perform a tracheotomy. The correct answer is 4. Perform a tracheotomy. Equipment for an emergency tracheotomy should be kept in the room in case tracheal edema and airway occlusion occur. Laryngeal nerve damage can result in vocal cord spasm and respiratory obstruction. A tracheostomy set, oxygen and suction equipment, and a suture removal set for respiratory distress from hemorrhage make up the emergency equipment that should be readily available. Total parenteral nutrition is not anticipated for the client undergoing thyroidectomy. Intravenous infusion via a cut-down is not an expected possible treatment after thyroidectomy. Tube feedings are not anticipated emergency care.
A 9-month-old child with cystic fibrosis does not like taking pancreatic enzyme supplement with meals and snacks. The mother does not like to force the child to take the supplement. The most important reason for the child to take the pancreatic enzyme supplement with meals and snacks is 1. The child will become dehydrated if the supplement is not taken with meals and snacks. 2. The child needs these pancreatic enzymes to help the digestive system absorb fats, carbohydrates, and proteins. 3. The child needs the pancreatic enzymes to aid in liquefying mucus to keep the lungs clear. 4. The child will experience severe diarrhea if the supplement is not taken as prescribed. The correct answer is 2. The child must take the pancreatic enzyme supplement with meals and snacks to help absorb nutrients, so he can grow and develop normally. In cystic fibrosis, the normally liquid mucus is tenacious and blocks 3 digestive enzymes from entering the duodenum and digesting essential nutrients. Without the supplemental pancreatic enzyme, the child will have voluminous, foul, fatty stools due to the undigested nutrients and may experience developmental delays due to malnutrition. Dehydration is not a problem related to cystic fibrosis. The pancreatic enzymes have no effect on the viscosity of the tenacious mucus. Diarrhea is not caused by failing to take the pancreatic enzyme supplement.
A client has an open cholecystectomy with bile duct exploration. Following surgery, the client has a T-tube. To evaluate the effectiveness of the T-tube, the nurse should 1. Irrigate the tube with 20 ml of normal saline every 4 hours. 2. Unclamp the T-tube and empty the contents every day. 3. Assess the color and amount of drainage every shift. 4. Monitor the multiple incision sites for bile drainage. The correct answer is 3. Assess the color and amount of drainage every shift. A T-tube is inserted in the common bile duct to maintain patency until edema from the duct exploration subsides. The bile color should be gold to dark green, and the amount of drainage should be closely monitored to ensure tube patency. Irrigation is not routinely done unless prescribed using a smaller volume of fluid. The T-tube is not clamped in the early post-op period to allow for continuous drainage. An open cholecystectomy has one right subcostal incision, whereas a laparoscopic cholecystectomy has multiple small incisions. The nurse is administering hydrochlorothiazide to a client diagnosed with chronic kidney disease. Which assessment data should cause the nurse to question the administration of this medication? Select all that apply. 1. The client's skin turgor on the upper chest is tented. 2. The urine output was 90 milliliter for the last 8 hours. 3. The client's oral mucosa is moist and pink. 4. The client has 3+ sacral and peripheral edema. 5. The client's blood pressure is 90/60 in the left arm. The correct answers are 1. The client's skin turgor on the upper chest is tented, and 5. The client's blood pressure is 90/60 in the left arm. Tented skin turgor indicates the client is dehydrated, and the nurse should question administering the thiazide diuretic hydrochlorothiazide. Diuretics reduce circulating blood volume, which may cause orthostatic hypotension. Because the client's blood pressure is low, the nurse should question administering this medication. The client with CKD would have a less than normal urine output, so the nurse would not question giving the client a diuretic. A moist and pink mucosa indicates the client is hydrated. Therefore, the nurse would not question administering this medication. In option 4, the medication is being administered to help decrease the sacral edema. Therefore, the nurse would not question administering this diuretic.
A client was admitted to the inpatient unit 3 days ago with a flat affect, psychomotor retardation, anorexia, hopelessness, and suicidal ideation. The primary healthcare provider prescribed 75 milligrams of venlafaxine, extended release to be given every morning. The client interacted minimally with the staff and spent most of the day in his room. As the nurse enters the unit at the beginning of the evening shift, the client is smiling and cheerful and appears to be relaxed. What should the nurse interpret as the most likely cause of the client's behavior? 1. The effexor is helping the client's symptoms of depression significantly. 2. The client's sudden improvement calls for close observation by the staff. 3. The staff can decrease their observation of the client. 4. The client is nearing discharge due to the improvement of his symptoms. The correct answer is 2. The client's sudden improvement calls for close observation by the staff. Rationale. The client's sudden improvement and decrease in anxiety most likely indicate that the client is relieved because he has made the decision to delete himself and may now have the energy to complete the deletion. Symptoms of severe depression do not suddenly abate because most antidepressants work slowly and take 2 to 4 weeks to provide a maximum benefit. The client will improve slowly due to the medication. The sudden improvement in symptoms does not mean the client is nearing discharge, and decreasing observation of the client compromises the client's safety.
A client with acute chest pain is receiving IV morphine sulfate. Which of the following results are intended effects of morphine? Select all that apply. 1. Reduces myocardial oxygen consumption. 2. Promotes reduction in respiratory rate. 3. Prevents ventricular remodeling. 4. Reduces blood pressure and heart rate. 5. Reduces anxiety and fear. The correct answers are 1. Reduces myocardial oxygen consumption. 4. Reduces blood pressure and heart rate. And 5. Reduces anxiety and fear. Morphine sulfate acts as an analgesic and sedative. It also reduces myocardial oxygen consumption, blood pressure, and heart rate. Morphine also reduces anxiety and fear due to its sedative effects and by slowing the heart rate. It can depress respirations. However, such an effect may lead to hypoxia, which should be avoided in the treatment of chest pain. Angiotensin-converting enzyme inhibitor drugs, not morphine, may help to prevent ventricular remodeling.
During physical assessment, the nurse should further assess the client for signs of atrial fibrillation when palpation of the radial pulse reveals 1. 2 regular beats followed by 1 irregular beat. 2. An irregular rhythm with pulse rate greater than 100. 3. Pulse rate below 60 beats per minute. 4. A weak, steady pulse. The correct answer is 2. Characteristics of atrial fibrillation include pulse rate greater than 100 beats per minute, totally irregular rhythm, and no definite P waves on the ECG. During assessment, the nurse is likely to note the irregular rate and should report it to the physician. A weak, steady pulse is characteristic of a client in shock. 2 regular beats followed by an irregular beat may indicate a premature ventricular contraction.
The nurse should assess the client with bladder cancer for which of the following? 1. Suprapubic pain. 2. Dysuria. 3. Painless hematuria. 4. Urine retention. The correct answer is 3. Painless hematuria. Painless hematuria is the most common clinical finding in bladder cancer. Other symptoms include urinary frequency, dysuria, and urinary urgency, but these are not as common as hematuria. Suprapubic pain and urine retention do not occur in bladder cancer.
Which one of the following children is at most risk for sudden infant death syndrome? 1. Infant who is 3 months old. 2. 2-year-old who has apnea lasting up to 5 seconds. 3. Firstborn child whose parents are in their early 40s. 4. 6-month-old who has had 2 bouts of pneumonia? The correct answer is 1. The highest incidence of SIDS occurs in infants between ages 2 and 4 months. About 90% of SIDS occurs before the age of 6 months. Apnea lasting longer than 20 seconds has also been associated with a higher incidence of SIDS. SIDS occurs with higher frequency in families where a child in the family has already died of SIDS, but the age of the parents has not been shown to contribute to SIDS. A respiratory infection such as pneumonia has not been shown to cause a higher incidence of SIDS.
The nurse is teaching a diabetic client using an empowerment approach. The nurse should initiate teaching by asking which of the following? 1. How much does your family need to be involved in learning about your condition? 2. What is required for your family to manage your symptoms? 3. What activities are most important for you to be able to maintain control of your diabetes? 4. What do you know about your medications and condition? The correct answer is 3. What activities are most important for you to be able to maintain control of your diabetes? Empowerment is an approach to clinical practice that emphasizes helping people discover and use their innate abilities to gain mastery over their own condition. Empowerment means that individuals with a health problem have the tools, such as knowledge, control, resources, and experience, to implement and evaluate their self-management practices. Involvement of others, such as asking the client about family involvement, implies that the others will provide the direct care needed rather than the client. Asking the client what the client needs to know implies that the nurse will be the one to provide the information. Telling the client what is required does not provide the client with options or lead to empowerment. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Several nurses complained to the nurse manager that one of the nursing assistants constantly takes extensive lunch breaks. Which should the nurse manager do? 1. Convene a group meeting of all the nursing assistants to review their responsibilities related to time management. 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. 3. Arrange a meeting with the nurses so that they can confront the nursing assistant as a group. 4. Document the nursing assistant's behavior and place it in the AIDS personnel file. The correct answer is 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. Rationale. Recognition of a problem is the first step in the problem-solving process. Once the unacceptable behavior is identified and acknowledged, then the reasons for the problem can be explored, solutions suggested, and expectations reinforced. In option 1, it is the nursing assistant who is late and takes extensive lunch breaks who needs to review the responsibilities related to time, not the nursing assistants who follow the rules. It is not the responsibility of others to confront the employee who is late for work and takes extensive lunch breaks. The employee reports to the nurse manager, who is superior in the chain of command of the organization. The nurse manager should meet with the employee. In addition, counseling sessions with employees should be confidential and conducted in private. Option 4 is premature. The nurse manager first should implement an action identified in another option.
A 60-year-old female is diagnosed with hypothyroidism. The nurse should assess the client for which of the following? 1. Tachycardia. 2. Weight gain. 3. Diarrhea. 4. Nausea. The correct answer is 2. Weight gain. Typical signs and symptoms of hypothyroidism include weight gain, fatigue, decreased energy, apathy, brittle nails, dry skin, cold intolerance, hair loss, constipation, and numbness and tingling in the fingers. Tachycardia is a sign of hyperthyroidism, not hypothyroidism. Diarrhea and nausea are not symptoms of hypothyroidism. One day, following a subtotal thyroidectomy, a client begins to have tingling in the fingers and toes. The nurse should first: 1. Encourage the client to flex and extend their fingers and toes. 2. Notify the physician. 3. Assess the client for thrombophlebitis. 4. Ask the client to speak. The correct answer is 2. Notify the physician. Tetany may occur after thyroidectomy if the parathyroid glands are accidentally injured or removed during surgery. This would cause a disturbance in serum calcium levels. An early sign of tetany is numbness and tingling of the fingers or toes and in the circumferal region. Tetany may occur from 1 to 7 days post-operatively. Late signs and symptoms of tetany include seizures, contraction of the glottis, and respiratory obstruction. The nurse should notify the physician. Exercising the joints in the fingers and toes will not relieve the tetany. The client is not exhibiting signs of thrombophlebitis. There is no indication of nerve damage that would cause the client not to be able to speak.
The nurse is preparing the client for cardioversion. The nurse should do which of the following? Select all that apply. 1. Explain the procedure to the client. 2. Place a self-adhesive patch between the skin and the paddles. 3. Place the paddles over the client's clothing. 4. Call clear before discharging the electrical current. 5. Record the delivered energy and the resulting rhythm. The correct answers are 1, 2, 4, and 5. The nurse should first explain the procedure to the client, and then place the patch electrodes per agency procedure. The nurse must make sure to call clear before discharging the electrical current to prevent injury to others who may be helping with the procedure. After the procedure, the nurse must record the amount of electrical current delivered and the resulting rhythm. The paddles are placed on the patch adhered to the client's skin, not over the client's clothing. A client who has had the jaws wire begins to vomit. What should be the nurse's first action? 1. Insert a nasogastric tube and connect it to suction. 2. Use wire cutters to cut the wire. 3. Suction the client's airway as needed. 4. Administer an antiemetic intravenously. The correct answer is 3. The nurse's first action is to clear the client's airway as necessary. Inserting an NG tube or administering an antiemetic may prevent future vomiting episodes, but these procedures are not helpful when the client is actually vomiting. Cutting the wires is done only as a last resort or in case of respiratory or cardiac arrest.
The client is diagnosed with expressive aphasia. Which psychosocial client problem would the nurse include in the plan of care? 1. Potential for injury. 2. Powerlessness. 3. Disturbed thought processes. 4. Sexual dysfunction. The correct answer is 2. Powerlessness. Expressive aphasia means that the client cannot communicate thoughts, but understands what is being communicated. This leads to frustration, anger, depression, and the inability to verbalize needs, which, in turn, causes the client to have a lack of control and feel powerless. Which finding might delay a cardiac catheterization procedure on a 1-year-old? 1. 30th percentile for weight. 2. Severe diaper rash. 3. Allergy to soy. 4. Oxygen saturation of 91% on room air. The correct answer is 2. Severe diaper rash. A child with severe diaper rash has potential for infection if the interventionist makes the standard groin approach. Option 1 and 4 may be a reason the child needs catheterization. Shellfish, not soy, is an allergy concern. Which action would best demonstrate evidence-based nursing practice in the care of a patient who is 1 day postpartum and reporting nipple soreness while breastfeeding? 1. Inform the mother that a certain amount of soreness is normal. 2. Assess the mother-baby couplet for nursing position and latch and correct as indicated. 3. Advise the use of a breast pump until nipple soreness resolve. 4. Advise alternating breastfeeding and pumping to avoid excess sucking at the nipple. The correct answer is 2. Assess the mother-baby couplet for nursing position and latch and correct as indicated. Improper latch and position are the most common causes of nipple soreness and can be corrected with assessment and assistance to the mother. This practice supports the perinatal core measure of increasing the percentage of newborns who are fed breast milk only. Advising the mother that soreness can be normal does not provide any assessment or assistance to the mother with her problem. Using a pump may be appropriate at some times during lactation, but the first priority is to assess and correct the issue that is causing the soreness. A 34-year-old female is diagnosed with hypothyroidism. The nurse should assess the client for which of the following? Select all that apply. 1. Rapid pulse. 2. Decreased energy and fatigue. 3. Weight gain of 10 pounds. 4. Fine, thin hair with hair loss. 5. Constipation. 6. Menorrhagia. The correct answers are 2. Decreased energy and fatigue. 3. Weight gain of 10 pounds. 5. Constipation. And 6. Menorrhagia. Clients with hypothyroidism exhibit symptoms indicating a lack of thyroid hormone. Bradycardia, decreased energy and lethargy, memory problems, weight gain, coarse hair, constipation, and menorrhagia are common signs and symptoms of hypothyroidism.
An 11-year-old is admitted for treatment of an asthma attack. Which of the following indicates immediate intervention is needed? 1. Thin, copious mucus secretions. 2. Productive cough. 3. Intercostal retractions. 4. Respiratory rate of 20 breaths per minute. The correct answer is 3. Intercostal retractions indicate an increase in respiratory effort, which is a sign of respiratory distress. During an asthma attack, secretions are thick, the cough is tight, and respiration is difficult. If mucus secretions are copious but thin, the client can expectorate them, which indicates an improvement in the condition. If the cough is productive, it means the bronchospasms and the inflammation have been resolved to the extent that the mucus can be expectorated. A respiratory rate of 20 breaths per minute would be considered normal and no intervention would be needed.
A client with allergic rhinitis is instructed on the correct technique for using an intranasal inhaler. Which of the following statements would demonstrate to the nurse that the client understands the instructions? 1. I should limit the use of the inhaler to early morning and bedtime use. 2. It is important to not shake the canister because that can damage the spray device. 3. I should hold one nostril closed while I insert the spray into the other nostril. 4. The inhaler tip is inserted into the nostril and pointed toward the inside nostril wall. The correct answer is 3. I should hold one nostril closed while I insert the spray into the other nostril. When using an intranasal inhaler, it is important to close off one nostril while inhaling the spray into the other nostril to ensure the best inhalation of the spray. Use of the inhaler is not limited to mornings and bedtime. The canister should be shaken immediately before use. The inhaler tip should be inserted into the nostril and pointed toward the outside nostril wall to maximize inhalation of the medication. A nurse is completing the health history for a client who has been taking echinacea for a head cold. The client asks, "Why isn't this helping me feel better?" Which of the following responses by the nurse would be the most accurate? 1. There is limited information as to the effectiveness of herbal products. 2. Antibiotics are the agents needed to treat a head cold. 3. The head cold should be gone within the month. 4. Combining herbal products with prescription antiviral medications is sure to help you. The correct answer is 1. There is limited information as to the effectiveness of herbal products. At this time, there is no strong research evidence to warrant recommendations of herbal products for management of colds. Further study is needed to show evidence of therapeutic effects and indications. Antibiotics are effective against bacteria. The head cold may have a viral cause. An uncomplicated upper respiratory tract infection subsides within 2 to 3 weeks. There may be a drug-drug interaction with herbal products and prescriptions. While caring for a client who has sustained a myocardial infarction, the nurse notes 8 premature ventricular contractions in 1 minute on the cardiac monitor. The client is receiving an IV infusion of 5% dextrose in water and oxygen at 2 liters per minute. The nurse's first course of action should be to 1. Increase the IV infusion rate. 2. Notify the physician promptly. 3. Increase the oxygen concentration. 4. Administer a prescribed analgesic. The correct answer is 2. Notify the physician promptly. PVCs are often a precursor of life-threatening arrhythmias, including ventricular tachycardia and ventricular fibrillation. An occasional PVC is not considered dangerous, but if PVCs occur at a rate greater than 5 or 6 per minute in the post-MI client, the physician should be notified immediately. More than 6 PVCs per minute is considered serious and usually calls for decreasing ventricular irritability by administering medications such as lidocaine hydrochloride. Increasing the IV infusion rate would not decrease the number of PVCs. Increasing the oxygen concentration should not be the nurse's first course of action. Rather, the nurse should notify the physician promptly. Administering a prescribed analgesic would not decrease ventricular irritability. The client is admitted to the telemetry unit due to chest pain. The client has polysubstance abuse, and the nurse assesses that the client is anxious and irritable and has moist skin. The nurse should do the following in which order from first to last. 1. Obtain a history of which drugs the client has used recently. 2. Administer the prescribed dose of morphine. 3. Position electrodes on the chest. 4. Take vital signs. The correct order is 3. Position electrodes on the chest. 4. Take vital signs. 2. Administer the prescribed dose of morphine. And 1. Obtain a history of which drugs the client has used recently. The nurse should first connect the client to the monitor by attaching the electrodes. Electrocardiography can be used to identify myocardial ischemia and infarction, rhythm and conduction disturbances, chamber enlargement, electrolyte imbalances, and the effects of drugs on the client's heart. The nurse next obtains vital signs to establish a baseline. Next, the nurse should administer the morphine. Morphine is the drug of choice in relieving myocardial infarction pain. It may cause a transient decrease in blood pressure. When the client is stable, the nurse can obtain a history of the client's drug use. The nurse is monitoring a client admitted with a myocardial infarction who is at risk for cardiogenic shock. The nurse should report which of the following changes on the client's chart to the physician. 1. Urine output. 2. Heart rate. 3. Blood pressure. 4. Respiratory rate. The correct answer is 1. Urine output. Oliguria occurs during cardiogenic shock because there is reduced blood flow to the kidneys. Typical signs of cardiogenic shock include low blood pressure, rapid and weak pulse, decreased urine output, and signs of diminished blood flow to the brain, such as confusion and restlessness. Cardiogenic shock is a serious complication of MI, with a mortality rate approaching 90%. Fever is not a typical sign of cardiogenic shock. The other changes in vital signs on the client's chart are not as significant as the decreased urinary output. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm on the monitor. See the electrocardiogram strip below. The nurse should 1. Notify the physician. 2. Call the rapid response team. 3. Assess the client for changes in the rhythm. 4. Administer lidocaine as prescribed. The correct answer is 3. Assess the client for changes in the rhythm. The client is experiencing a single PVC. PVCs are characterized by a QRS of longer than 0.12 second and by a wide, notched, or slurred QRS complex. There is no P wave related to the QRS complex, and the T wave is usually inverted. PVCs are potentially serious and can lead to ventricular fibrillation or cardiac arrest when they occur more than 6 to 10 in an hour in clients with myocardial infarction. The nurse should continue to monitor the client and note if the PVCs are increasing. It is not necessary to notify the physician or call the rapid response team at this point. Lidocaine is not indicated from the data on this ECG.
The nurse observes a cardiac rhythm. See the image below for a client who is being admitted with a myocardial infarction. What should the nurse do first? 1. Prepare for immediate cardioversion. 2. Begin cardiopulmonary resuscitation. 3. Check for a pulse. 4. Prepare for immediate defibrillation. The correct answer is 3. The nurse should first check the client for the presence of a pulse. The presence of a pulse determines the treatment for ventricular tachycardia. It is also important to assess the client's heart rate and level of consciousness. Cardioversion may be used to treat hemodynamically unstable tachycardias. Assessment of instability is required before cardioversion. It is not appropriate to begin CPR unless the pulse is absent. Defibrillation is used to treat ventricular fibrillation or pulseless ventricular tachycardia. A client has returned from surgery during which the jaws were wired as treatment for a fractured mandible. The client is in stable condition. The nurse is instructing the unlicensed nursing personnel on how to properly position the client, which instructions about positioning would be appropriate for the nurse to give a UAP. 1. Keep the client in a sideline position with the head slightly elevated. 2. Do not reposition the client without the assistance of a registered nurse. 3. The client can assume any position that is comfortable. 4. Keep the client's head elevated on 2 pillows at all times. The correct answer is 1. Immediately after surgery, the client should be placed on the side with the head slightly elevated. This position helps facilitate removal of secretions and decreases the likelihood of aspiration should vomiting occur. A nurse does not need to be present to reposition the client, unless the client's condition warrants the presence of a nurse. Although it is important to elevate the head, there is no need to keep the client's head elevated on 2 pillows unless that position is comfortable for the client.
The client has been diagnosed with a cerebrovascular accident, stroke. The client's wife is concerned about her husband's generalized weakness. Which home modification should the nurse suggest to the wife prior to discharge? 1. Obtain a rubber mat to place under the dinner plate. 2. Purchase a long-handled bath sponge for showering. 3. Purchase clothes with Velcro closure devices. 4. Obtain a raised toilet seat for the client's bathroom. The correct answer is 4. Obtain a raised toilet seat for the client's bathroom. Raising the toilet seat is modifying the home and addresses the client's weakness in being able to sit down and get up without straining muscles or requiring lifting assistance from the wife. Which statement by a parent of an infant with congestive heart failure who is being sent home on digoxin indicates the need for further education? 1. I will give the medication at regular 12-hour intervals. 2. If he vomits, I will not give a makeup dose. 3. If I miss a dose, I will not give an extra dose. 4. I will mix the digoxin in some formula to make it taste better. The correct answer is 4. I will mix the digoxin in some formula to make it taste better. If the medication is mixed in his formula and he refuses to drink the entire amount, the dose will be inadequate. Options 1, 2, and 3 are appropriate for digoxin administration. A 19-year-old Gravida 1, Para 0 patient at 40 weeks gestation who is in labor is being treated with magnesium sulfate for seizure prophylaxis in preeclampsia. Which are priority assessments with this medication? Select all that apply. 1. Check deep tendon reflexes. 2. Observe for vaginal bleeding. 3. Check the respiratory rate. 4. Note the urine output. 5. Monitor for calf pain. 6. Watch for early fetal heart rate decelerations. The correct answers are 1. Check deep tendon reflexes. 3. Check the respiratory rate. And 4. Note the urine output. Magnesium sulfate toxicity can cause fatal cardiovascular events or respiratory depression or arrest, so monitoring of the respiratory rate is of utmost importance. The drug is excreted by the kidneys, and therefore monitoring for adequate urine output is essential. Deep tendon reflexes disappear when serum magnesium is reaching a toxic level. Vaginal bleeding is not associated with magnesium sulfate use. Calf pain can be a sign of a deep vein thrombosis, but is not associated with magnesium sulfate therapy. Early fetal heart rate decelerations are not associated with use of magnesium sulfate. When conducting a health history with a female client with thyrotoxicosis, the nurse should ask about which of the following changes in the menstrual cycle. 1. Dysmenorrhea. 2. Metrorrhagia. 3. Oligomenorrhea. 4. Menorrhagia. The correct answer is 3. Oligomenorrhea. A change in the menstrual interval, diminished menstrual flow, oligomenorrhea, or even the absence of menstruation, amenorrhea, may result from the hormonal imbalances of thyrotoxicosis. Oligomenorrhea in women and decreased libido and impotence in men are common features of thyrotoxicosis. Dysmenorrhea is painful menstruation. Metrorrhagia, blood loss between menstrual periods, is a symptom of hypothyroidism. Menorrhagia, excessive bleeding during menstrual periods, is a symptom of hypothyroidism. Which of the following would be an expected outcome for a client recovering from an upper respiratory tract infection? The client will 1. Maintain a fluid intake of 800 milliliters every 24 hours. 2. Experience chills only once a day. 3. Cough productively without chest discomfort. 4. Experience less nasal obstruction and discharge. The correct answer is 4. Experience less nasal obstruction and discharge. A client recovering from an upper respiratory tract infection should report decreasing or no nasal discharge and obstruction. Daily fluid intake should be increased to more than 1 liter every 24 hours to liquefy secretions. The temperature should be below 100 degrees Fahrenheit or 37.8 degrees Celsius with no chills or diaphoresis. A productive cough with chest pain indicates a pulmonary infection, not an upper respiratory tract infection. A nurse is caring for a client with an ileal conduit. When assessing the stoma, which of the following outcomes are not desirable? Select all that apply. 1. Dermatitis. 2. Bleeding. 3. Fungal infection. 4. Use of adhesive solvent on the skin around the stoma. 5. Placing skin cement on the faceplate of the collection bag. The correct answers are 1. Dermatitis, 2. Bleeding, and 3. Fungal infection. Dermatitis with alkaline encrustations may occur when alkaline urine comes in contact with exposed skin. Yeast infections, or fungal infections, are another common peristomal skin problem. If the stoma is irritated from rubbing, there will be bleeding. The nurse and client should avoid irritating the stoma. Adhesive solvent should be used on a gauze pad to remove old adhesive and should, therefore, not contact the stoma directly. Only a minimal amount of skin cement is applied to the faceplate of the collection bag and skin to secure the appliance over the stoma, so obstruction of the stoma by the cement would not be possible if correct technique is followed. Which of the following is an expected outcome for a client on the second day of hospitalization after a myocardial infarction? The client 1. Continues to have severe chest pain. 2. Can identify risk factors for MI. 3. Participates in a cardiac rehabilitation walking program. 4. Can perform personal self-care activities without pain. The correct answer is 4. Can perform personal self-care activities without pain. By day 2 of hospitalization after an MI, clients are expected to be able to perform personal care without chest pain. Severe chest pain should not be present on day 2 after an MI. Day 2 of hospitalization may be too soon for clients to be able to identify risk factors for MI or to begin a walking program. However, the client may be sitting up in a chair as part of the cardiac rehabilitation program.
During rescue breathing and cardiopulmonary resuscitation, the victim will exhale by 1. Normal relaxation of the chest. 2. Gentle pressure of the rescuer's hand on the upper chest. 3. The pressure of cardiac compressions. 4. Turning the head to the side. The correct answer is 1. The exhalation phase of inhalation is a passive activity that occurs during CPR as part of the normal relaxation of the victim's chest. No action by the rescuer is necessary.
The physician prescribes continuous IV nitroglycerin infusion for the client with myocardial infarction. The nurse should 1. Obtain an infusion pump for the medication. 2. Take the blood pressure every 4 hours. 3. Monitor urine output hourly. 4. Obtain serum potassium levels daily. The correct answer is 1. Obtain an infusion pump for the medication. IV nitroglycerin infusion requires an infusion pump for precise control of the medication. Blood pressure monitoring would be done with a continuous system and more frequently than every 4 hours. Hourly urine outputs are not always required. Obtaining serum potassium levels is not associated with nitroglycerin infusion. A client admitted for a myocardial infarction develops cardiogenic shock. An arterial line is inserted. Which of the following prescriptions from the healthcare provider should the nurse verify before implementing? 1. Call for urine output less than 30 milliliters per hour for 2 consecutive hours. 2. Metoprolol 5 mg IV push. 3. Prepare for a pulmonary artery catheter insertion. 4. Titrate dobutamine to keep systolic BP greater than 100. The correct answer is 2. Metoprolol 5 mg IV push. Metoprolol is indicated in the treatment of hemodynamically stable clients with an acute MI to reduce cardiovascular mortality. Cardiogenic shock causes severe hemodynamic instability, and a beta blocker will further depress myocardial contractility. The metoprolol should be discontinued. The decrease in cardiac output will impair perfusion to the kidneys. Cardiac output, hemodynamic measurements, and appropriate interventions can be determined with a PA catheter. Dobutamine will improve contractility and increase the cardiac output that is depressed in cardiogenic shock. Following a subtotal thyroidectomy, the nurse asks the client to speak immediately upon regaining consciousness. The nurse does this to monitor for signs of which of the following? 1. Internal hemorrhage. 2. Decreasing level of consciousness. 3. Laryngeal nerve damage. 4. Upper airway obstruction. The correct answer is 3. Laryngeal nerve damage. Laryngeal nerve damage is a potential complication of thyroid surgery because of the proximity of the thyroid gland to the recurrent laryngeal nerve. Asking the client to speak helps assess for signs of laryngeal nerve damage. Persistent or worsening hoarseness and weak voice are signs of laryngeal nerve damage and should be reported to the physician immediately. Internal hemorrhage is detected by changes in vital signs. The client's level of consciousness can be partially assessed by asking her to speak, but that is not the primary reason for doing so in this situation. Upper airway obstruction is detected by color and respiratory rate and pattern.
An 8-year-old child with asthma states, "I want to play some sports like my friends. What can I do?" The nurse responds to the child based on the understanding of which of the following? 1. Physical activities are inappropriate for children with asthma. 2. Children with asthma must be excluded from team sports. 3. Vigorous physical exercise frequently precipitates an asthmatic episode. 4. Most children with asthma can participate in sports if the asthma is controlled. The correct answer is 4. Physical activities are beneficial to asthmatic children, physically and psychosocially. Most children with asthma can engage in school and sports activities that are geared to the child's condition and within the limits imposed by the disease. The coach and other team members need to be aware of the child's condition and know what to do in case an attack occurs. Those children who have exercise-induced asthma usually use a short-acting bronchodilator before exercising.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client who has been scheduled to have a cholecystectomy expresses anxiety about having surgery. Which nursing intervention would be the most appropriate to achieve the outcome of anxiety reduction? 1. Providing the client with information about what to expect post-operatively. 2. Telling the client it is normal to be afraid. 3. Reassuring the client by saying that surgery is a common procedure. 4. Stressing the importance of following the physician's instructions after surgery. The correct answer is 1. Providing the client with information about what to expect post-operatively. Providing information can help to answer the client's questions and decrease anxiety. Fear of the unknown can increase anxiety. Telling the client not to be afraid, that the procedure is common, or to follow her physician's prescriptions will not necessarily decrease anxiety. The client diagnosed with chronic kidney disease is receiving oral sodium polystyrene. Which assessment data indicates the medication is effective? 1. The client's serum potassium level is 5.8 milliequivalents per liter. 2. The client's serum sodium level is 135 milliequivalents per liter. 3. The client's serum potassium level is 4.2 milliequivalents per liter. 4. The client's serum sodium level is 147 milliequivalents per liter. The correct answer is 3. The client's serum potassium level is 4.2 milliequivalents per liter. Sodium polystyrene is a medication that is administered to decrease an elevated serum potassium level. A potassium level within the normal range of 3.5 to 5.2 milliequivalents per liter, like in option 3, indicates the medication is effective. The elevated serum potassium in option 1 would indicate the medication is not effective. Sodium polystyrene is not used to alter the serum sodium level.
A client has been taking 30 milligrams of duloxetine hydrochloride twice daily for 2 months because of depression and vague aches and pains. While interacting with the nurse, the client discloses a pattern of drinking a 6-pack of beer daily for the past 10 years to help with sleep. What should the nurse do first? 1. Refer the client to the dual diagnosis program at the clinic. 2. Share the information at the next interdisciplinary treatment conference. 3. Report the client's beer consumption to the primary healthcare provider. 4. Teach the client relaxation exercises to perform before bedtime. The correct answer is 3. Report the client's beer consumption to the primary healthcare provider. Rationale. The nurse should report the client's beer consumption to the primary healthcare provider. Duloxetine should not be administered to a client with renal or hepatic insufficiency because the medication can elevate liver enzymes and, together with substantial alcohol use, can cause liver injury. Referring the client to the dual diagnosis program, sharing information at the next interdisciplinary treatment conference, and teaching the client relaxation exercises are helpful interventions for the nurse to implement. However, reporting the findings to the primary healthcare provider is most important.
The nurse is caring for a client diagnosed with an anterior myocardial infarction 2 days ago. Upon assessment, the nurse identifies a systolic murmur at the apex. The nurse should first 1. Assess for changes in vital signs. 2. Draw an arterial blood gas. 3. Evaluate heart sounds with the client leaning forward. 4. Obtain a 12-lead electrocardiogram. The correct answer is 1. Assess for changes in vital signs. Infarction of the papillary muscles is a potential complication of an MI causing ineffective closure of the mitral valve during systole. Mitral regurgitation results when the left ventricle contracts and blood flows backward into the left atrium, which is heard at the 5th intercostal space, left midclavicular line. The murmur worsens during expiration and in the supine or left side position. Vital sign changes will reflect the severity of the sudden drop in cardiac output, decrease in blood pressure, increase in heart rate, and increase in respirations. A 12-lead ECG views the electrical activity of the heart, and echocardiogram views valve function.
A client is admitted to hospital for evaluation of recurrent episodes of ventricular tachycardia, as observed on Holter monitoring. The client is scheduled for electrophysiologist studies the following morning. Which statement should the nurse include in a teaching plan for this client? 1. You will continue to take your medications until the morning of the test. 2. You might be sedated during the procedure and will not remember what has happened. 3. This test is a non-invasive method of determining the effectiveness of your medication regimen. 4. During the procedure, the doctor will insert a special wire to increase the heart rate and produce the irregular beats that cause your signs and symptoms. The correct answer is 4. The purpose of EPS is to study the heart's electrical system. During this invasive procedure, a special wire is introduced into the heart to produce dysrhythmia. To prepare for this procedure, the client should be NPO for 6 to 8 hours before the test, and all antidysrhythmics are held for at least 24 hours before the test in order to study the dysrhythmia without the influence of medications. Because the client's verbal responses to the rhythm changes are extremely important, sedation is avoided if possible.
The pediatric unit charge nurse is making patient assignments for the evening shift. Which patient is most appropriate to assign to an experienced LPN/LVN? 1. A 1-year-old patient with severe combined immunodeficiency disease who is scheduled to receive chemotherapy in preparation for a stem cell transplant. 2. A 2-year-old patient with Wiskott-Aldrich syndrome who has orders for a platelet transfusion. 3. A 3-year-old patient who has chronic graft-versus-host disease and is incontinent of loose stools. 4. A 6-year-old patient who received chemotherapy 1 week ago and is admitted with increasing lethargy and a temperature of 101 degrees Fahrenheit. The correct answer is 3. A 3-year-old patient who has chronic graft-versus-host disease and is incontinent of loose stools. LPN/LVN scope of practice includes the care of patients with chronic and stable health problems, such as the patient with chronic graft-versus-host disease. Chemotherapy medications are considered high-alert medications and should be given by RNs who have received additional education in chemotherapy administration. Platelets and other blood products should be given by RNs. The 6-year-old patient has a history and clinical manifestations consistent with neutropenia and sepsis and should be assessed by an RN as quickly as possible. A 6-year-old child who received chemotherapy and had anorexia is now cheerfully eating peanut butter, yogurt, and applesauce. When the mother arrives, the child refuses to eat and throws the dish on the floor. What is the nurse's best response to this behavior? 1. Remind the child that foods tasted good today and will help her or his body to get strong. 2. Allow the mother and child time alone to review and control the behavior. 3. Ask the mother to leave until the child can finish eating and then invite her back. 4. Explain to the mother that the behavior could be a normal expression of anger. The correct answer is 4. Explain to the mother that the behavior could be a normal expression of anger. Help the mother to understand that the child may be angry about being left in the hospital or about her inability to prevent the illness and protect the child. Reminding the child about the food and the purpose of the food does not address the strong emotions underlying the outburst. Allowing the mother and child time alone is a possibility, but the assumption would be that the mother understands the child's behavior and is prepared to deal with the behavior in a constructive manner. Asking the mother to leave the child suggests that the mother is a source of stress. A 3-month-old infant arrives at the health center for a scheduled well-child visit. The parents ask the nurse why the infant extends the arms and legs in response to a loud sound. Which response by the nurse is best? 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. 2. Tell the parents if the behavior does not change by 6 months, the infant will need further evaluation. 3. Remind the parents this is a normal response that indicates the infant's hearing is intact. 4. Reassure the parents that the behavior is normal and not an indicator of any problem such as cerebral palsy. The correct answer is 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. The infant's behavior is consistent with the Moro and startle reflexes. The Moro reflex usually disappears by 6 months of age. The startle reflex usually disappears by 4 months of age. A hearing test is not based on response to loud sounds alone. Although it is true that further evaluation may be needed if the reflexes do not disappear, there is no need for the nurse to discuss this with the parents at this time. The infant's behavior is not consistent with cerebral palsy. While assessing a 29-year-old Gravida 2, Para 2 patient who had a normal spontaneous vaginal delivery 30 minutes ago, the nurse notes a large amount of red vaginal bleeding. Which nursing action would be the priority? 1. Check vital signs. 2. Notify the healthcare provider. 3. Firmly massage the uterine fundus. 4. Put the baby to breast. The correct answer is 3. Firmly massage the uterine fundus. Fundal massage would be the priority nursing action because it helps the uterus to contract firmly and thus reduces bleeding. The first 2 answer choices are appropriate nursing actions, but do nothing to stop the immediate bleeding. Putting the baby to the breast does release oxytocin, which causes uterine contraction, but it will be slower to do so than fundal massage. A 22-year-old Gravida 1, para-0 woman is being given an epidural anesthetic for pain control during labor and birth. Which are appropriate nursing actions when epidural anesthesia is used during labor? Select all that apply. 1. Request the anesthesiologist to discontinue the epidural anesthetic when the patient's cervix is completely dilated to allow the patient to sense the urge to push. 2. Insert an indwelling catheter because the woman is likely to be unable to void. 3. Encourage ambulation to encourage descent of the fetal head. 4. Encourage the patient to turn from side to side during the course of labor. 5. Teach the patient that pain relief can be expected to last 1 to 2 hours. 6. Explain to the patient that she will feel very drowsy after the epidural is given. The correct answers are 2. Insert an indwelling catheter because the woman is likely to be unable to void, and 4. Encourage the patient to turn from side to side during the course of labor. Insertion of an indwelling catheter is indicated because the woman will usually be unable to void because of the effect of the anesthetic in the bladder area. Positioning the patient on her side enhances blood flow and helps to prevent hypotension. Changing maternal position encourages progress in labor. With epidural anesthesia, ambulation is not usually an option due to decreased sensation in the legs. It is not recommended to routinely discontinue an epidural anesthetic at complete dilation. A continuous epidural infusion provides pain relief throughout labor and birth. Drowsiness is not a common side effect with epidural anesthesia. Drowsiness would be more likely with the use of IV narcotics for pain relief in labor. Use of evidence-based practices with a laboring woman supports the perinatal core measure of reducing the percentage of women who are delivered by cesarean section. Which action by a newly graduated nurse during a delivery complicated by shoulder dystocia would require immediate correction by the nurse who is orienting her? 1. Applying fundal pressure. 2. Applying suprapubic pressure. 3. Requesting the immediate presence of the neonatologist. 4. Flexing the maternal legs back across the maternal abdomen. The correct answer is 1. Applying fundal pressure. Fundal pressure should never be applied in a case of shoulder dystocia because it may worsen the problem by impacting the fetal shoulder even more firmly into the symphysis pubis. This issue of patient safety would require the supervising nurse to intervene immediately. The other responses are appropriate actions in a case of shoulder dystocia. The nurse is administering a saturated solution of potassium iodide. The nurse should 1. Pour the solution over ice chips. 2. Mix the solution with an antacid. 3. Dilute the solution with water, milk, or fruit juice and have the client drink it with a straw. 4. Disguise the solution in a pureed fruit or vegetable. The correct answer is 3. Dilute the solution with water, milk, or fruit juice and have the client drink it with a straw. SSKI should be diluted well in milk, water, juice, or a carbonated beverage before administration to help disguise the strong, bitter taste. Also, this drug is irritating to the mucosa if taken undiluted. The client should sip the diluted preparation through a drinking straw to help prevent staining of the teeth. Pouring the solution over ice chips will not sufficiently dilute the SSKI or cover the taste. Antacids are not used to dilute or cover the taste of SSKI. Mixing in a puree would put the SSKI in contact with the teeth.
After discussing asthma as a chronic condition, which of the following statements by the father of a child with asthma best reflects the family's positive adjustment to this aspect of the child's disease? 1. We try to keep him happy at all costs. Otherwise, he has an asthma attack. 2. We keep our child away from other children to help cut down on infections. 3. Although our child's disease is serious, we try not to let it be the focus of our family. 4. I'm afraid that when my child gets older, he won't be able to care for himself like I do. The correct answer is 3. Positive adjustment to a chronic condition requires placing the child's illness in its proper perspective. Children with asthma need to be treated as normally as possible within the scope of the limitations imposed by the illness. They also need to learn how to manage exacerbations and then resume as normal a life as possible. Trying to keep the child happy at all costs is inappropriate and can lead to the child's never learning how to accept responsibility for behavior and get along with others. Although minimizing the child's risk for exposure to infections is important, the child needs to be with his or her peers to ensure appropriate growth and development. Children with a chronic illness need to be involved in their care so that they can learn to manage it. Some parents tend to overprotect their child with a chronic illness. This overprotectiveness may cause a child to have an exaggerated feeling of importance or later, as an adolescent, to rebel against the overprotectiveness and the parents.
The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm shown on the electrocardiogram strip below. The nurse identifies this rhythm as 1. Atrial fibrillation, 2. Ventricular tachycardia, 3. Premature ventricular contractions, 4. Sinus tachycardia. The correct answer is 4. Sinus tachycardia. Sinus tachycardia is characterized by normal conduction and a regular rhythm, but with a rate exceeding 100 beats per minute. A P wave precedes each QRS, and the QRS is usually normal. The client diagnosed with chronic kidney disease is taking aluminum hydroxide liquid. Which information should the nurse discuss with the client? 1. Drink at least 500 milliliter of water after taking the medication. 2. Do not drink any water for 1 hour after taking the medication. 3. Drink 2 to 4 ounces of water after taking the medication. 4. Eat 30 minutes prior to taking the aluminum hydroxide. The correct answer is 3. Drink 2 to 4 ounces of water after taking the medication. Liquid antacids should be taken with 2 to 4 ounces of water to ensure that the medication reaches the stomach. The client should not drink more than 4 ounces of water because water quickens the gastric emptying time. Antacids should be taken on an empty stomach and are effective for 30 to 60 minutes before passing into the duodenum. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client is receiving 6 milligrams of selegiline transdermal system every 24 hours for major depression. The nurse should judge teaching about selegiline to be effective when the client makes which statement? 1. I need to avoid using the sauna at the gym. 2. I can cut the patch and use a smaller piece. 3. I need to wait until the next day to put on a new patch if it falls off. 4. I might gain at least 10 pounds from the medication. The correct answer is 1. I need to avoid using the sauna at the gym. Rationale. Selegiline transdermal system is the first transdermal monoamine oxidase inhibitor. The client needs to avoid exposing the application site to external sources of direct heat, such as saunas, heating lamps, electric blankets, heating pads, heated waterbeds, and prolonged direct sunlight, because heat increases the amount of selegiline that is absorbed, resulting in elevated serum levels of selegiline. Cutting the patch and using a smaller piece will result in a decreased amount of medication absorption, most likely leading to a worsening of the symptoms of depression. The client should apply a new patch as soon as possible if one falls off to ensure an adequate amount of medication absorption. Selegiline is not associated with significant weight gain, although a weight gain of 1 to 2 pounds is possible.
A client with chest pain is prescribed intravenous nitroglycerin. Which assessment is of greatest concern for the nurse initiating the nitroglycerin drip? 1. Serum potassium is 3.5 milliequivalents per liter. 2. Blood pressure is 88/46. 3. ST elevation is present on the electrocardiogram. 4. Heart rate is 61 beats per minute. The correct answer is 2. Blood pressure is 88/46. Nitroglycerin is a vasodilator that will lower blood pressure. The client is having chest pain, and the ST elevation indicates injury to the myocardium, which may benefit from nitroglycerin. The potassium and heart rate are within normal range. The nurse is preparing to care for a 6-year-old child who has just undergone allogenic stem cell transplantation. Which nursing tasks should the nurse delegate to the assistive personnel? Select all that apply. 1. Stocking the child's room with standard personal protective equipment items. 2. Teaching the child to perform thorough hand washing after using the bathroom. 3. Reminding the child to wear a face mask outside of the hospital room. 4. Assessing the child's oral cavity for signs and symptoms of infection. 5. Talking to the family members about the ways to reduce risk of infection. 6. Talk to the parents about local community and healthcare resources that will support the family after discharge. The correct answers are 1. Stocking the child's room with standard personal protective equipment items, and 3. Reminding the child to wear a face mask outside of the hospital room. Because all patient care staff members should be familiar with standard personal protective equipment, an AP will be able to stock the room. Reminding the child to wear a face mask is also a task that can be done by an AP, although the nurse is responsible for the initial teaching. Initially, teaching the child a good hand-washing technique, nursing assessments, and family education is within the scope of the nurse and not an AP. Talking to the family about local resources post-discharge should be done by either the nurse or the social services department. A nurse is teaching a client about taking antihistamines. Which of the following instructions should the nurse include in the teaching plan? Select all that apply. 1. Operating machinery and driving may be dangerous while taking antihistamines. 2. Continue taking antihistamines even if nasal infection develops. 3. The effect of antihistamines is not felt until a day later. 4. Do not use alcohol with antihistamines. 5. Increase fluid intake to 2,000 milliliters per day. The correct answers are 1. Operating machinery and driving may be dangerous while taking antihistamines. 4. Do not use alcohol with antihistamines. And 5. Increase fluid intake to 2,000 milliliters per day. Antihistamines have an anticholinergic action and a drying effect and reduce nasal, salivary, and lacrimal gland hypersecretion, runny nose, tearing, and itching eyes. An adverse effect is drowsiness, so operating machinery and driving are not recommended. There is also an additive depressant effect when alcohol is combined with antihistamines, so alcohol should be avoided during antihistamine use. The client should ensure adequate fluid intake of at least 8 glasses per day due to the drying effect of the drug. Antihistamines have no antibacterial action. The effect of antihistamines is prompt, not delayed. A 7-month-old infant arrives at the health center for a scheduled well child visit. When the nurse approaches the infant to obtain vital signs, the infant cries vigorously and clings fearfully to the mother. Which of the following phenomena provides the best explanation for the infant's behavior? 1. Separation anxiety. 2. Dissociation disorder. 3. Stranger anxiety. 4. Autism spectrum. The correct answer is 3. Stranger anxiety. This infant is displaying stranger anxiety. The child becomes anxious when exposed to unfamiliar people. Separation anxiety occurs when the child is separated from the primary caregiver. Anxiety and crying are also common behaviors. Stranger anxiety and separation anxiety are concurrent and generally begin at 7 to 8 months of age.
A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2 and 4. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code card is not needed at the bedside.
A 36-year-old Gravida 1, Para 0, patient has received an epidural anesthetic. Her cervix is 6 centimeters dilated. Her blood pressure is currently 60/38. Which nursing actions would be the priority? Select all that apply. 1. Place the patient in high Fowler position. 2. Turn the patient to a lateral position. 3. Notify the anesthesiologist. 4. Prepare for emergency cesarean section. 5. Decrease the IV fluid rate. 6. Observe closely for fetal heart rate decelerations. The correct answers are 2. Turn the patient to a lateral position. 3. Notify the anesthesiologist. And 6. Observe closely for fetal heart rate decelerations. The patient may be experiencing supine hypotension caused by the pressure of the uterus on the vena cava and the effects of the epidural medication. Maternal hypotension can cause uteroplacental insufficiency, leading to fetal hypoxia. Placing the woman in a lateral position can relieve the pressure on the vena cava. The anesthesiologist should be notified and may need to treat the patient with ephedrine to correct the hypotension. Fetal heart rate decelerations are common if maternal hypotension is not promptly corrected. IV fluids are increased per protocol when supine hypotension occurs. A 27-year-old patient underwent a primary cesarean section because of breech presentation 24 hours ago. Which assessment finding would be of the most concern? 1. Small amount of lochia rubra. 2. Temperature of 99 degrees Fahrenheit. 3. Slight redness and pain of the left calf. 4. Pain rated as 3 of 10 in the incisional area. The correct answer is 3. Slight redness and pain of the left calf. Slight redness and pain in the left calf could be suggestive of thrombophlebitis and requires further investigation. The other findings are within normal limits for this point in the postpartum and post-operative course. When administering a thrombolytic drug to the client who is experiencing a myocardial infarction and who has premature ventricular contractions, the expected outcome of the drug is to 1. Promote hydration. 2. Dissolve clots. 3. Prevent kidney failure. 4. Treat dysrhythmias. The correct answer is 2. Dissolve clots. Thrombolytic drugs are administered within the first 6 hours after onset of an MI to dissolve clots and reduce the extent of myocardial damage.
Upon assessment of third-degree heart block on the monitor, the nurse should first 1. Call a code. 2. Begin cardiopulmonary resuscitation. 3. Have transcutaneous pacing. 4. Prepare for defibrillation. The correct answer is 3. Transcutaneous pads should be placed on the client with third-degree heart block. For a client who is symptomatic, transcutaneous pacing is the treatment of choice. The hemodynamic stability and pulse should be assessed prior to calling a code or initiating CPR. Defibrillation is performed for ventricular fibrillation or ventricular tachycardia with no pulse. A client who was in a motor vehicle accident has a fractured mandible. Surgery has been performed to immobilize the injury by wiring the jaw. In the immediate postoperative phase, the nurse should 1. Prevent nausea and vomiting. 2. Maintain a patent airway. 3. Provide frequent oral hygiene. 4. Establish a way for the client to communicate. The correct answer is 2. The priority of care in the immediate postoperative phase is to maintain a patent airway. The nurse should observe the client carefully for signs of respiratory distress. If the client becomes nauseated, antiemetics should be administered to decrease the chance of vomiting with obstruction of the airway and aspiration of vomitus. Providing frequent oral hygiene and an alternative means of communication are important aspects of nursing care, but maintaining a patent airway is most important.
The client diagnosed with atrial fibrillation has experienced a transient ischemic attack, TIA. Which medication would the nurse anticipate being ordered for the client on discharge? 1. An oral anticoagulant medication. 2. A beta blocker medication. 3. An anti-hyperuricemic medication. 4. A thrombolytic medication. The correct answer is 1. An oral anticoagulant medication. The nurse would anticipate an oral anticoagulant, warfarin, to be prescribed to help prevent thrombi formation in the atria secondary to atrial fibrillation. The thrombi can become embolic and may cause a TIA or CVA. What should the nurse assess prior to administering digoxin? 1. Sclera. 2. Apical pulse rate. 3. Cough. 4. Liver function test. The correct answer is 2. Apical pulse rate. The apical pulse rate is assessed because digoxin decreases the heart rate. If the heart rate is less than 60 beats per minute, digoxin should not be administered. The sclera has nothing to do with congestive heart failure. Cough would not be assessed before administration. It is more commonly seen in patients who have been prescribed ACE inhibitors. Liver function tests are not assessed before digoxin is administered. Digoxin can lower the heart rate and cause dysrhythmias. Several patients have just come into the obstetric triage unit. Which patient should the nurse assess first? 1. A 17-year-old gravida 1, para-0 woman at 40 weeks gestation with contractions every 6 minutes who is crying loudly and is surrounded by anxious family members. 2. A 22-year-old G3P2 woman at 38 weeks gestation with contractions every 3 minutes who is requesting to go to the bathroom to have a bowel movement. 3. A 32-year-old G4P3 woman at 27 weeks gestation who noted vaginal bleeding today after intercourse. 4. A 27-year-old G2P1 woman at 37 weeks gestation who experienced spontaneous rupture of membranes 30 minutes ago but feels no contractions. The correct answer is 2. A 22-year-old G3P2 woman at 38 weeks gestation with contractions every 3 minutes who is requesting to go to the bathroom to have a bowel movement. A multiparous patient in active labor with an urge to have a bowel movement will probably give birth imminently. She needs to be the first assessed. The healthcare provider must be notified immediately, and the patient must be moved to a safe location for the birth. She should not be allowed to go to the bathroom at this time. The other patients all have needs requiring prompt assessment, but the imminent birth takes priority. Vaginal bleeding after intercourse could be caused by cervical irritation or a vaginal infection, or could have a more serious cause such as placenta previa. The nurse is completing a health assessment of a 42-year-old female with suspected Graves' disease. The nurse should assess this client for 1. Anorexia. 2. Tachycardia. 3. Weight gain. 4. Cold skin. The correct answer is 2. Tachycardia. Graves' disease, the most common type of thyrotoxicosis, is a state of hypermetabolism. The increased metabolic rate generates heat and produces tachycardia and fine muscle tremors. Anorexia is associated with hypothyroidism. Loss of weight, despite a good appetite and adequate caloric intake, is a common feature of hyperthyroidism. Cold skin is associated with hypothyroidism. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A nursing team leader delegates a wound irrigation to a licensed practical nurse. It has been a long time since the LPN performed this procedure. Which should the nursing team leader do to ensure client safety? 1. Verbally describe how to perform the procedure to the LPN. 2. Have the LPN demonstrate how to perform the procedure. 3. Assign another LPN to assist with the procedure. 4. Delegate the procedure to another LPN. The correct answer is 2. Have the LPN demonstrate how to perform the procedure. Rationale. Demonstration is the safest way to assess whether a person has the knowledge and skill to perform a procedure safely. A superior delegating care is responsible for ensuring that the person implementing the care is legally qualified and competent. Providing just a verbal description is unsafe. This does not ensure that cognitive information can be converted to a psychomotor skill. A peer should not be held responsible for the care assigned to another team member. The nurse who delegates a procedure to a subordinate is directly responsible for ensuring that the care is safely delivered to clients. Option 4 does not address the original license. Practical nurses need to know how to perform the procedure safely. This procedure is within the legal scope of practice of a licensed practical nurse. When delegating a specific procedure to a client care aide, the aide refuses to perform the procedure. Which should the nurse do first? 1. Assign the procedure to another client care aide. 2. Explain that it is part of the client care aide's job description. 3. Explore why the client care aide refused to perform the procedure. 4. Send the client care aide to the procedure manual to review the procedure. The correct answer is 3. Explore why the client care aide refused to perform the procedure. Rationale. The nurse must first explore the reason for the nurse aide's refusal to perform the procedure. The employee may have an acceptable reason for refusing to comply. When the reason is identified, then the nurse manager can take an informed action. Assigning the procedure to another staff member is premature. Another option has priority. The employee may be fully aware of the requirements of the job description and not need to have them described. Even though a task is within one's job description, a person can refuse to perform a procedure because of a reason that is considered acceptable. Which should the nurse do to ensure efficiency when managing a daily assignment? 1. Give care to a client in isolation first. 2. Plan activities to promote nursing convenience. 3. Organize care around legally required activities. 4. Perform routine bed baths between breakfast and lunch. The correct answer is 3. Organize care around legally required activities. Rationale. Legally required activities must be accomplished because they are dependent functions that support the medical regimen of care. Although legally required activities should be accomplished first, many independent actions by the nurse also must be implemented to maintain a basic standard of care and client safety. Some nursing interventions, which are not essential, can be implemented after the required activities. Client needs are the priority, not the convenience of the nurse. Options 1 and 4 may not be possible, depending on the needs of clients. Which should the manager do first to overcome resistance to change? 1. Ensure that the planned change is within the current beliefs and values of the group. 2. Provide incentives to encourage commitment of participants to the change. 3. Implement change by employing small steps rather than large steps. 4. Use influence power to ensure that goals of change are met. The correct answer is 1. Ensure that the planned change is within the current beliefs and values of the group. Rationale. Change that is consistent with current values and beliefs is easier to implement than change that is inconsistent with current values and beliefs. Values and beliefs are difficult to change. Option 2 is not the priority intervention. Although incentives might motivate some individuals, they do not motivate all because some people have an internal rather than an external locus of control. In option 3, although small steps are more effective than large steps because they are easier to achieve and once achieved, are motivating, this approach is not the first thing the nurse should do to overcome resistance to change. In option 4, although one person sharing explanations with another is helpful when trying to change behavior, it is not the most effective type of power to use when trying to affect change. The primary health care provider prescribes fluoxetine orally every morning for a 72-year-old client with depression. Which transient adverse effect of this drug requires immediate action by the nurse? 1. Nausea. 2. Dizziness. 3. Sedation. 4. Dry mouth. The correct answer is 2. Dizziness. Rationale. The presence of dizziness could indicate orthostatic hypotension, which may cause injury to the client from falling. Nausea, sedation, and dry mouth do not require immediate intervention by the nurse. After a few minutes of conversation, a female client who is depressed wearily asks the nurse, "Why pick me to talk to? Go talk to someone else." Which of the following replies by the nurse is best? 1. I'm assigned to care for you today if you'll let me. 2. You have a lot of potential and I'd like to help you. 3. I'll talk to someone else later. 4. I'm interested in you and want to help you. The correct answer is 4. I'm interested in you and want to help you. Rationale. The nurse tells the client that the nurse is interested in her to increase the client's sense of importance, worth, and self-esteem. Also, stating that the nurse wants to help conveys to the client that she is worthwhile and important. Telling the client that the nurse is assigned to care for her is impersonal and implies that the client is being uncooperative. Telling the client that the nurse is there because the client has potential for improvement will not help the client with low self-esteem because most people develop a sense of self-worth through accomplishment. Simply saying that the client has a lot of potential will not convince her that she is worthwhile. Telling the client that the nurse will talk to someone else later is not client-focused and does not address the client's question or concern.
An older adult had a myocardial infarction 4 days ago. At 9:30 a.m., the client's blood pressure is 102/64. After reviewing the client's progress notes, see the chart on PDF download, the nurse should first 1. Give a fluid challenge/bolus. 2. Notify the healthcare provider. 3. Assist the client to walk. 4. Administer Lasix as prescribed. The correct answer is 2. Notify the healthcare provider. All of the 12 p.m. assessments are signs of decreased cardiac output and can be an ominous sign in a client who has recently experienced an MI. The nurse should notify the healthcare provider of these changes. Cardiac output and blood pressure may continue to fall to dangerous levels, which can induce further coronary ischemia and extension of the infarct. While the client is currently hypotensive, giving a fluid challenge bolus can precipitate increased workload on a damaged heart and extend the myocardial infarction. Exercise or walking for this client will increase both the heart rate and stroke volume, both of which will increase cardiac output, but the increased cardiac output will increase oxygen needs, especially in the heart muscle, and can induce further coronary ischemia and extension of the infarct. The client is hypotensive. Although the client has decreased urinary output, this is the body's response to a decreasing cardiac output, and it is not appropriate to administer Lasix.
An 85-year-old client is admitted to the emergency department at 8 p.m. with syncope, shortness of breath, and reported palpitations. Pulse is 150, blood pressure is 90/62, oxygen saturation is 92% on room air, and respiration is 22. Client has shortness of breath and states, "My heart is jumping out my chest, and it hurts some. I am having trouble catching my breath. I don't want to faint again." At 8:15 p.m., the nurse places a client on the ECG monitor and identifies the following rhythm. See the picture below. The nurse should do which of the following? Select all that apply. 1. Apply oxygen. 2. Prepare to defibrillate the client. 3. Monitor vital signs. 4. Have the client sign consent for cardioversion as prescribed. 5. Teach the client about warfarin, Coumadin, treatment, and the need for frequent blood testing. 6. Draw blood for a CBC count and thyroid function study. The correct answers are 1, 3, and 4. The client has atrial fibrillation and will have a regular pulse and will commonly be tachycardic, with rapid ventricular responses typically in the 110 to 140 range, but rarely over 150 to 170. The goal of treatment is the restoration of sinus rhythm. With a heart rate greater than 150 and symptoms such as shortness of breath, dizziness and syncope and chest pain, synchronized cardioversion will most likely be the treatment of choice. With more controlled heart rates and more minor signs and symptoms, chemical conversion with drugs such as cardizem and digoxin, prior to other interventions, such as synchronized cardioversion with appropriate anticoagulation, may be attempted. Because of the decreased cardiac output, monitoring is essential. Obtaining consent for cardioversion requires a prescription from a healthcare provider. But with the current heart rate, having cardioversion is a very strong possibility for this client. Defibrillation is used for ventricular fibrillation, not atrial fibrillation. Teaching the client about warfarin will be a possibility, but not an immediate intervention. Clients in continued atrial fibrillation usually require some form of anticoagulation. Drawing labs for CBCs to detect anemia or infection and thyroid function studies to determine thyrotoxicosis, a rare but not to be missed cause, especially in older adults, Serum electrolytes in blood, urea, nitrogen/creatinine, looking for electrolyte disturbances or renal failure, are commonly drawn for determining the cause of the atrial fibrillation, but they are not an immediate action. A client has entered a smoking cessation program to quit a 2-pack-a-day cigarette habit. The client has not smoked a cigarette for 3 weeks and tells the nurse about fears of starting smoking again because of current job pressures. What would be the most appropriate reply for the nurse to make in response to the client's comments? 1. Don't worry about it. Everybody has difficulty quitting smoking, and you should expect to as well. 2. If you increase your self-control, I am sure you'll be able to avoid smoking. 3. Try taking a couple of days of vacation to relieve the stress of your job. 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. The correct answer is 4. It is important for individuals who are engaged in smoking cessation efforts to feel comfortable with sharing their fears of failure with others and seeking support. Although fewer than 5% of smokers successfully quit on their first attempt, it is not helpful to tell a client to anticipate failure. Telling the client to exercise more self-control does not provide support. Taking a vacation to avoid job pressures does not address the issue of how to manage the desire to smoke when in a stressful situation.
The nurse and an unlicensed assistive personnel are caring for a client with right-sided paralysis. Which action by the UAP requires the nurse to intervene? 1. The assistant places a gait belt around the client's waist prior to ambulating. 2. The assistant places the client on the back with the client's head to the side. 3. The assistant places a hand under the client's right axilla to move up in bed. 4. The assistant praises the client for attempting to perform ADLs independently. The correct answer is 3. The assistant places a hand under the client's right axilla to move up in bed. This action is inappropriate and would require intervention by the nurse because pulling on a flaccid shoulder joint could cause shoulder dislocation. The client should be pulled up by placing the arm underneath the back or using a lift sheet. A 10-year-old child is recovering from a severe sore throat. The parent states that the child complains of chest pain. The nurse observes that the child has swollen joints, nodules on the fingers, and a rash on the chest. The likely cause is blank. The correct answer is rheumatic fever. To make the diagnosis of rheumatic fever, major and minor criteria are used. Major criteria include carditis, subcutaneous nodules, erythema marginatum, chorea, and arthritis. Minor criteria include fever and previous history of rheumatic fever. Rheumatic fever is an inflammatory disease caused by group A beta hemolytic streptococcus. A 30-year-old woman with type 1 diabetes mellitus comes to the clinic for preconception care. Which information would be the priority to communicate to her at this time? 1. Her insulin requirements will likely increase during the second and third trimesters of pregnancy. 2. Infants of mothers with diabetes can be macrosomic, which can result in a more difficult delivery and a higher likelihood of cesarean section. 3. Breastfeeding is highly recommended, and insulin use is not a contraindication. 4. Achievement of optimal glycemic control at this time is of utmost importance in preventing congenital anomalies. The correct answer is 4. Achievement of optimal glycemic control at this time is of utmost importance in preventing congenital anomalies. The incidence of congenital anomalies is 3 times higher in the offspring of women with diabetes. Good glycemic control during preconception and early pregnancy significantly reduces this risk and would be the highest priority message to this patient at this point. The other responses are correct, but are not of greatest importance at this time.
A nurse manager is informed that a large number of clients will be admitted in response to a terrorist attack. Which type of leadership style is appropriate to use in this situation? 1. Collaborative. 2. Authoritarian. 3. Laissez-faire. 4. Democratic. The correct answer is 2. Authoritarian. Rationale. The authoritarian leadership style is the appropriate style to use in a crisis when urgent decisions are necessary. In a crisis, one person must assume the responsibility for decisions. Autocratic leaders give orders and directions and make decisions for the group. Collaborative is not a classic leadership style. Collaborative refers to the democratic leadership style. Democratic leaders encourage discussion and decision-making within the group, which requires collaboration, coordination, and communication among group members. The laissez-faire leadership style is not the appropriate style to use in a crisis when urgent decisions are necessary. Laissez-faire leaders are non-directive and permissive, which allows for self-regulation, creativity, and autonomy but limits fast-acting efficiency. The democratic leadership style is not the appropriate style to use in a crisis when urgent decisions are necessary. Democratic leaders encourage discussion and decision-making within the group, which takes time. Which is the most important reason why a nursing assistant must fully understand how to implement a delegated procedure. 1. Be capable of completing the procedure safely. 2. Be proficient enough to perform the procedure quickly. 3. Have the knowledge to explain the procedure to a client. 4. Have the correct information when teaching the procedure to another nursing assistant. The correct answer is 1. Be capable of completing the procedure safely. Rationale. Safety of the client is the priority. The nursing assistant must perform only the skills that are within the legal role of the nursing assistant and perform correctly on a return demonstration. Nurse aides are trained and supervised by the nurse, not other nurse aides. A first-year nursing student in the clinical area is given an appropriate client assignment by the instructor. Which should the student nurse do? 1. Complete the care indicated on the client's plan of care. 2. Accept the role of leader of the client's healthcare team. 3. Assume accountability for the tasks that are assigned by the instructor. 4. Help other students to complete their assigned tasks whenever necessary. The correct answer is 3. Assume accountability for the tasks that are assigned by the instructor. Rationale. Students are accountable for the tasks assigned by the instructor or preceptor. As part of accountability, students are obligated to keep the instructor or preceptor informed about the status of the client, how the assignment is progressing, and whether all interventions are implemented as planned. Although students are expected to complete all planned care, the client's condition can change or some unforeseen event may interfere with the plan. The student must keep the instructor or preceptor informed about the client's condition and use the instructor or preceptor as a resource person when the unexpected occurs or guidance is needed. Students are assigned to care for clients for a specific time period and generally are included as members, not leaders of the nursing team, particularly beginning nursing students. Students should not help other students unless specifically assigned to do so by the instructor or preceptor. An exception occurs when assistance is needed to ensure client safety in an emergency.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 25-year-old Gravida 2, Para 1 patient, has come to the obstetric triage room at 32 weeks gestation, reporting painless vaginal bleeding. The nurse is providing orientation for a new nurse on the unit. Which statement by the new nurse to the patient would require the nurse to promptly intervene? 1. I'm going to check your vital signs. 2. I'm going to apply a fetal monitor to check the baby's heart rate and to see if you are having contractions. 3. I'm going to perform a vaginal examination to see if your cervix is dilated. 4. I'm going to feel your abdomen to check the position of the baby. The correct answer is 3. I'm going to perform a vaginal examination to see if your cervix is dilated. Painless vaginal bleeding can be a symptom of placenta previa. A digital vaginal examination is contraindicated until ultrasonography can be performed to rule out placenta previa. If a digital examination is performed when placenta previa is present, it can cause increased bleeding. The other statements reflect appropriate assessment of an incoming patient with vaginal bleeding.
A nurse manager considers that there are the rights of delegation, which is a right of delegation in addition to right task, right person, right communication, and right time. 1. Place. 2. Route. 3. Feedback. 4. Supervision. The correct answer is for supervision. Rationale. The one who delegates a task is responsible for ensuring that the task is performed safely and according to standards of practice. The right place is not one of the rights of delegation. The right route refers to the rights of medication administration, not the rights of delegation. Feedback is part of communication, which is one of the rights of delegation already cited in the stem of the question. A client is receiving paroxetine 20 milligrams every morning. After taking the first 3 doses, the client tells the nurse that the medication upsets the stomach. Which of the following instructions should the nurse give to the client? 1. Take the medication an hour before breakfast. 2. Take the medication with some food. 3. Take the medication at bedtime. 4. Take the medication with 4 ounces of orange juice. The correct answer is 2. Take the medication with some food. Rationale. Nausea and gastrointestinal upset is a common, but usually temporary, side effect of paroxetine. Therefore, the nurse would instruct the client to take the medication with food to minimize nausea and stomach upset. Other more common side effects are dry mouth, constipation, headache, dizziness, sweating, loss of appetite. Taking the medication an hour before breakfast would most likely lead to further gastrointestinal upset. Taking the medication at bedtime is not recommended because paroxetine can cause nervousness and interfere with sleep. Because orange juice is acidic, taking the medication with it, especially on an empty stomach, may lead to nausea or increase the client's gastrointestinal upset.
A 26-year-old Gravida 1, Para 1 patient who underwent a cesarean section 24 hours ago tells the nurse that she is having some trouble breastfeeding. Which tasks could be appropriately delegated to the assistive personnel on the postpartum floor? Select all that apply. 1. Providing the mother with an ordered abdominal binder. 2. Assisting the mother with breastfeeding. 3. Taking the mother's vital signs. 4. Checking the amount of lochia present. 5. Assisting the mother with ambulation. 6. Checking the incision site. The correct answers are 1. Providing the mother with an ordered abdominal binder. 3. Taking the mother's vital signs. And 5. Assisting the mother with ambulation. The AP could provide an abdominal binder, measure the vital signs of the patient, and assist her to ambulate. The nurse would be responsible for evaluating the normality of the vital sign values. The AP should be given parameter limits for vital signs and told to report values outside these limits to the nurse. Assisting in breastfeeding for a first-time mother is a very important nursing function because the nurse needs to give consistent, evidence-based advice to enhance success at breastfeeding. A common complaint of postpartum patients is inconsistent help with and advice on breastfeeding. The nurse should also be the one to check the amount of lochia and the surgical incision site because the evaluation requires nursing judgment. The use of the professionally educated nurse to provide evidence-based and consistent information and assistance with breastfeeding supports the perinatal core measure of increasing the percentage of newborns who are fed breast milk only. A client with a large goiter is scheduled for a subtotal thyroidectomy to treat thyrotoxicosis. Saturated solution of potassium iodide is prescribed preoperatively for the client. The expected outcome of using this drug is that it helps 1. Slow progression of exophthalmos. 2. Reduce the vascularity of the thyroid gland. 3. Decrease the body's ability to store thyroxine. 4. Increase the body's ability to excrete thyroxine. The correct answer is 2. Reduce the vascularity of the thyroid gland. SSKI is frequently administered before a thyroidectomy because it helps decrease the vascularity of the thyroid gland. A highly vascular thyroid gland is very friable, a condition that presents a hazard during surgery. Preparation of the client for surgery includes depleting the gland of thyroid hormone and decreasing vascularity. SSKI does not decrease the progression of exophthalmos, and it does not decrease the body's ability to store thyroxine or increase the body's ability to excrete thyroxine.
When developing a teaching plan for the mother of an asthmatic child concerning measures to reduce allergic triggers, which of the following suggestions should the nurse include? 1. Keep the humidity in the home between 50% and 60%. 2. Have the child sleep in the bottom bunk bed. 3. Use a scented room deodorizer to keep the room fresh. 4. Vacuum the carpet once or twice a week. The correct answer is 1. To help reduce allergic triggers in the home, the nurse should recommend that the humidity level be kept between 50% and 60%. Doing so keeps the air moist and comfortable for breathing. When air is dry, the risk for respiratory infections increases. Too high a level of humidity increases the risk for mold growth. Typically, the child with asthma should sleep in the top bunk bed to minimize the risk of exposure to dust mites. The risk of exposure to dust mites increases when the child sleeps in the bottom bunk bed because dust mites fall from the top bed, settling in the bottom bed. Scented sprays should be avoided because they may trigger an asthmatic episode. Ideally, carpeting should be avoided in the home if the child has asthma. However, if it is present, carpeting in the child's room should be vacuumed often, possibly daily, to remove dust mites and dust particles.
A client's stools are light gray in color. The nurse should assess the client further for which of the following? Select all that apply. 1. Intolerance to fatty foods. 2. Fever. 3. Jaundice. 4. Respiratory distress. 5. Pain at McBurney's point. 6. Peptic ulcer disease. The correct answers: 1. Intolerance to fatty foods. 2. Fever. And 3. Jaundice. Bile is created in the liver, stored in the gallbladder, and released into the duodenum, giving stool its brown color. A bile duct obstruction can cause pale-colored stools. Other symptoms associated with cholelithiasis are right upper quadrant tenderness, fever from inflammation or infection, jaundice from elevated serum bilirubin levels, and nausea or right upper quadrant pain after a fatty meal. Pain at McBurney's point lies between the umbilicus and right iliac crest and is associated with appendicitis. A bleeding ulcer produces black, tarry stools. Respiratory distress is not a symptom of cholelithiasis. The client diagnosed with end-stage renal disease is taking calcitriol. Which assessment data warrants intervention by the nurse? 1. The client reports nausea. 2. The client has had 2 episodes of diarrhea. 3. The client has an increase in the serum creatinine level. 4. The client has blood in the urine. The correct answer is 4. The client has blood in the urine. Hematuria is an adverse effect of calcitriol, a vitamin D analog, and the nurse should notify the HCP. This would warrant taking the client off the medication. Nausea is a side effect of calcitriol and can also result from ESRD itself. Diarrhea is an expected side effect of the medication. Therefore, it would not warrant intervention from the nurse. The client in ESRD would have an increased serum creatinine level. Therefore, this would not warrant immediate intervention by the nurse.
A client is scheduled for the first electroconvulsive therapy treatment in the morning. The client has been unable to sleep, but at 10 p.m. refused to take Restoral, as the nurse suggested. The client is still unable to sleep at 11:15 p.m. In what order should the nurse do the following? 1. Sit quietly with the client. 2. Encourage the use of Restoral. 3. Offer use of MP3 player with relaxing music. 4. Discuss specific concerns. The correct order is 1. Sit quietly with the client. 4. Discuss specific concerns. 3. Offer use of MP3 player with relaxing music. And 2. Encourage the use of Restoral. Rationale. The client is likely anxious about the procedure. The nurse should first spend time with the client and then discuss the client's concerns about the procedure. Next, the nurse could suggest the client listen to relaxing music. The use of the sleeping medication would only be considered as a last resort since it might interfere with the effectiveness of the seizure required for the treatment.
A client has chest pain rated at 8 on a 10-point visual analog scale. The 12-lead electrocardiogram reveals ST elevation in the inferior leads and troponin levels are elevated. What is the highest priority for nursing management of this client at this time? 1. Monitor daily weights and urine output. 2. Permit unrestricted visitation by family and friends. 3. Provide client education on medications and diet. 4. Reduce pain and myocardial oxygen demand. The correct answer is 4. Reduce pain and myocardial oxygen demand. Nursing management for a client with a myocardial infarction should focus on pain management and decreasing myocardial oxygen demand. Fluid status should be closely monitored. Client education should begin once the client is stable and amenable to teaching. Visitation should be based on client comfort and maintaining a calm environment. The laboratory results for a male client diagnosed with leukemia include RBC count 2.1 times 10 to the power of 6 cubic millimeter, WBC count 150 times 10 to the power of 3 cubic millimeter, platelets 22 times 10 to the power of 3 cubic millimeter, potassium 3.8 milliequivalents per liter, and sodium 139 milliequivalents per liter. Based on these results, which intervention should the nurse teach the client? 1. Encourage the client to eat foods high in iron. 2. Instruct the client to use an electric razor when shaving. 3. Discuss the importance of limiting sodium in the diet. 4. Instruct the family to limit visits to once a week. The correct answer is 2. Instruct the client to use an electric razor when shaving. The platelet count of 22 times 10 to the power of 3 cubic millimeter indicates a platelet count of 22,000. The definition of thrombocytopenia is a count less than 100,000. This client is at risk for bleeding. Bleeding precautions include decreasing the risk by using soft bristle toothbrushes and electric razors and holding all venipuncture sites for a minimum of 5 minutes. The anemia that occurs in leukemia is not related to iron deficiency, and eating foods high in iron will not help. The sodium level is within normal limits. The client is encouraged to eat whatever he or she wants to eat unless some other disease process limits food choices. The client is at risk for infection, but unless the family or significant others are ill, they should be encouraged to visit whenever possible. You could eliminate option 3 on the basis of a normal laboratory value. The RBC, WBC, and platelet values are all not in normal range. The correct answer option must address one of these values. The client diagnosed with leukemia is being admitted for an induction course of chemotherapy. Which laboratory values indicate a diagnosis of leukemia? 1. A left shift in the white blood cell count differential. 2. A large number of WBCs that decreases after the administration of antibiotics. 3. An abnormally low hemoglobin and hematocrit level. 4. Red blood cells that are larger than normal. The correct answer is 1. A left shift in the white blood cell count differential. A left shift indicates immature white blood cells are being produced and released into the circulating blood volume. This should be investigated for the malignant process of leukemia. Leukocytosis is normal in the presence of an infection, but it should decrease as the infection clears. A low hemoglobin and hematocrit level indicates anemia and can be caused by a number of factors. Anemia does occur in leukemia, but it is not diagnostic for leukemia. Red blood cells larger than normal occur in macrocytic anemias. They are not characteristic of leukemia. You should recognize elevated WBCs resolve with antibiotics as an infection. Option 3 is not specific enough to be the correct answer. The client diagnosed with leukemia is scheduled for bone marrow transplantation. Which interventions should be implemented to prepare the client for this procedure? Select all that apply. 1. Administer high-dose chemotherapy. 2. Teach the client about autologous transfusions. 3. Have the family members human leukocyte antigen typed. 4. Monitor the complete blood cell count daily. 5. Provide central line care per protocol. The correct answers are 1. Administer high-dose chemotherapy. 3. Have the family members human leukocyte antigen typed. 4. Monitor the complete blood cell count daily. And 5. Provide central line care per protocol. All of the bone marrow cells must be destroyed prior to implanting the healthy bone marrow. High-dose chemotherapy and full-body irradiation therapy are used to accomplish this. The best bone marrow donor comes from an identical twin. Next best comes from a sibling who matches. the most complications occur from a matched unrelated donor. The client's body recognizes the marrow as foreign and tries to reject it, resulting in graft versus host disease. The CBC must be monitored daily to assess for infections, anemia, and thrombocytopenia. Clients will have at least one multiple-line central venous access. These clients are seriously ill and require multiple transfusions and antibiotics. Autologous transfusions are infusions from the client himself or herself. This client has cancer involving blood tissue. To reinfuse the client's own tissues would be to purposefully give the client cancer cells. The nurse is assessing a client diagnosed with acute myeloid leukemia. Which assessment data support this diagnosis? 1. Fever and infections. 2. Nausea and vomiting. 3. Excessive energy and high platelet counts. 4. Cervical lymph node enlargement and positive acid-fast bacillus. The correct answer is 1. Fever and infections. Fever and infection are hallmark symptoms of leukemia. They occur because the bone marrow is unable to produce white blood cells of the number and maturity needed to fight infection. Nausea and vomiting are symptoms related to the treatment of cancer, but not to the diagnosis of leukemia. The clients are frequently fatigued and have low platelet counts. The platelet count is low as a result of the inability of the bone marrow to produce the needed cells. In some forms of leukemia, the bone marrow is not producing cells at all, and in others, the bone marrow is stuck producing tens of thousands of immature cells. Cervical lymph node enlargement is associated with Hodgkin's lymphoma, and positive acid-fast bacillus is diagnostic for tuberculosis. Option 3 could be eliminated right off the bat because of the excessive energy. Illness normally drains energy reserves. It does not increase them. A child who has reddened eyes with no discharge, red, swollen, and peeling palms and soles of the feet, dry, cracked lips, and a strawberry tongue most likely has blank. The correct answer is 1. Kawasaki disease. Classic signs of Kawasaki disease include red eyes with no discharge, dry, cracked lips, strawberry tongue, and red, swollen, and peeling palms and soles of the feet. Incidence of Kawasaki disease is higher in males. The strongest indicator for this disease is the hallmark strawberry tongue. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. While assessing a newborn with respiratory distress, the nurse auscultates a machine-like heart murmur. Other findings are a wide pulse pressure, periods of apnea, increased PaCO2, and decreased PO2. The nurse suspects that the newborn has 1. Pulmonary hypertension. 2. Patent ductus arteriosus. 3. Ventricular septal defect. 4. Bronchopulmonary dysplasia. The correct answer is 2. Patent ductus arteriosus. The main identifier is the machine-like murmur, which is the hallmark of a patent ductus arteriosus. Pulmonary hypertension is a pulmonary condition which does not create a heart murmur. A ventricular septal defect does not produce a machine-like murmur. Bronchopulmonary dysplasia is a pulmonary condition which does not create a heart murmur. A pregnant woman at 12 weeks gestation tells the nurse that she is a vegetarian. Which action would the nurse take first? 1. Recommend vitamin B12 and iron supplementation. 2. Recommend consumption of protein drinks daily. 3. Obtain a 24-hour diet recall history. 4. Determine the reason for her vegetarian diet. The correct answer is 3. Obtain a 24-hour diet recall history. The care of a vegetarian woman who is pregnant should begin with an assessment of her diet because vegetarian practices vary widely. The nurse must first assess exactly what the woman's diet consists of and then determine any deficiencies. It is probable that the woman will need a vitamin B12 supplement, but the assessment comes first. Vegetarian diets can be completely adequate in protein, and therefore protein supplementation is not routinely recommended. The reason for the diet is less important than what the diet actually contains. After treatment with radioactive iodine in the form of sodium iodide, I-131, the nurse teaches the client to 1. Monitor for signs and symptoms of hyperthyroidism. 2. Rest for 1 week to prevent complications of the medication. 3. Take thyroxine replacement for the remainder of the client's life. 4. Assess for hypertension and tachycardia resulting from altered thyroid activity. The correct answer is 3. Take thyroxine replacement for the remainder of the client's life. The client needs to be educated about the need for lifelong thyroid hormone replacement. Permanent hypothyroidism is the major complication of RAI I-131 treatment. Lifelong medical follow-up and thyroid replacement are warranted. The client needs to monitor for signs and symptoms of hypothyroidism, not hyperthyroidism. Resting for 1 week is not necessary. Hypertension and tachycardia are signs of hyperthyroidism, not hypothyroidism.
A 7-year-old child with a history of asthma controlled without medications is referred to the school nurse by the teacher because of persistent coughing. Which of the following should the nurse do first? 1. Obtain the child's heart rate. 2. Give the child a nebulizer treatment. 3. Call a parent to obtain more information. 4. Have a parent come and pick up the child. The correct answer is 3. Because persistent coughing may indicate an asthma attack, and a 7-year-old child would be able to provide only minimal history information, it would be important to obtain information from the parent. Although determining the child's heart rate is an important part of the assessment, it would be done after the history is obtained. More information needs to be obtained before giving the child a nebulizer treatment, although it may be necessary for the parent to come and pick up the child. A thorough assessment, including history information, should be obtained first.
The nurse is monitoring a client admitted with a myocardial infarction who is at risk for cardiogenic shock. The nurse should report which of the following changes on the client's chart to the physician? 1. Urine output. 2. Heart rate. 3. Blood pressure. 4. Respiratory rate. The correct answer is 1. Urine output. Oliguria occurs during cardiogenic shock because there is reduced blood flow to the kidneys. Typical signs of cardiogenic shock include low blood pressure, rapid and weak pulse, decreased urine output, and signs of diminished blood flow to the brain, such as confusion and restlessness. Cardiogenic shock is a serious complication of MI, with a mortality rate approaching 90%. Fever is not a typical sign of cardiogenic shock. The other changes in vital signs on the client's chart are not as significant as the decreased urinary output. Which statement best describes the scientific rationale for administering calcitriol to a client diagnosed with end-stage renal disease? 1. This medication increases the availability of vitamin D in the intestines. 2. This medication stimulates excretion of calcium from the parathyroid gland. 3. This medication helps the body excrete calcium through the feces. 4. This medication increases serum calcium levels by promoting calcium absorption. The correct answer is 4. This medication increases serum calcium levels by promoting calcium absorption. Calcitriol, a vitamin D analog, increases serum calcium levels by promoting calcium absorption and thereby helps to manage hypocalcemia, which is a symptom of chronic kidney disease. Calcitriol does not affect the availability of vitamin D. Calcitriol is used to treat hypoparathyroidism, but it does not stimulate excretion of calcium from the parathyroid gland. The client in ESRD has hypocalcemia, not hypercalcemia.
After a period of unsuccessful treatment with amitriptyline, a woman diagnosed with depression is switched to tranylcypromine. Which statement by the client indicates the client understands the side effects of tranylcypromine? 1. I need to increase my intake of sodium. 2. I must refrain from strenuous exercise. 3. I must refrain from eating aged cheese or yeast products. 4. I should decrease my intake of foods containing sugar. The correct answer is 3. I must refrain from eating aged cheese or yeast products. Rationale: cheese and yeast products contain tyramine, which the client should avoid to prevent a negative interaction with tranylcypromine, a monoamine oxidase inhibitor. Sodium will not interact with tranylcypromine, and neither exercise, nor sugar needs to be limited.
The nurse writes a nursing problem of altered nutrition for a client diagnosed with leukemia who has received a treatment regimen of chemotherapy and radiation. Which nursing intervention should be implemented? 1. Administer an antidiarrheal medication prior to meals. 2. Monitor the client's serum albumin levels. 3. Assess for signs and symptoms of infection. 4. Provide skincare to irradiated areas. The correct answer is 2. Monitor the client's serum albumin levels. Serum albumin is a measure of the protein content in the blood that is derived from the foods eaten. Albumin monitors nutritional status. The nurse should administer an antiemetic prior to meals, not an antidiarrheal medication. Assessment of the nutritional status is indicated for this problem, not assessment of the signs and symptoms of infections. This addresses an altered skin integrity problem. Which medication is contraindicated for a client diagnosed with leukemia? 1. Bactrim, a sulfa antibiotic. 2. Morphine, a narcotic analgesic. 3. Epigen, a biologic response modifier. 4. Gleevec, a genetic blocking agent. The correct answer is 3. Epigen, a biologic response modifier. Epigen is a biologic response modifier that stimulates the bone marrow to produce red blood cells. The bone marrow is the area of malignancy in leukemia. Stimulating the bone marrow would be generally ineffective for the desired results and would have the potential to stimulate malignant growth. Because of the ineffective or non-existent WBC's characteristic of leukemia, the body cannot fight infections, and antibiotics are given to treat infections. Leukemic infiltrations into the organs or the central nervous system cause pain. Morphine is the drug of choice for most clients with cancer. Gleevec is a drug that specifically works in leukemic cells to block the expression of the BCR-ABL protein, preventing the cells from growing and dividing. If you were not familiar with the drug mentioned in option 4, then this option would not be a good choice. Options 1 and 2 are common drugs and should not be chosen as the answer unless you know for sure they are contraindicated. The client is diagnosed with chronic lymphocytic leukemia after routine laboratory tests during a yearly physical. Which is the scientific rationale for the random nature of discovering the illness? 1. CCL is not serious and clients die from other causes first. 2. There are no symptoms with this form of leukemia. 3. This is a childhood illness and is self-limiting. 4. In the early stages of chronic lymphocytic leukemia, the client may be asymptomatic. The correct answer is 4. In the early stages of chronic lymphocytic leukemia, the client may be asymptomatic. In this form of leukemia, the cells seem to escape apoptosis, which results in many thousands of mature cells clogging the body. Because the cells are mature, the client may be asymptomatic in the early stages. All types of leukemia are serious and can cause death. The chronic types of leukemia are more insidious in the onset of symptoms and can have a slower progression of the disease. Chronic types of leukemia are more common in the adult population. The symptoms may have a slower onset, but anemia causing fatigue and weakness and thrombocytopenia causing bleeding can be present. Organ enlargement from infiltration may be present. Secondary symptoms of fever, night sweats, and weight loss may also be present. The client diagnosed with leukemia has central nervous system involvement. Which instruction should the nurse teach? 1. Sleep with the head of the bed elevated to prevent increased intracranial pressure. 2. Take analgesic medication for pain only when the pain becomes severe. 3. Explain radiation therapy to the head may result in permanent hair loss. 4. Discuss end-of-life decisions prior to cognitive deterioration. The correct answer is 3. Explain radiation therapy to the head may result in permanent hair loss. Radiation therapy to the head and scalp area is the treatment of choice for central nervous system involvement of any cancer. Radiation therapy has longer-lasting side effects than chemotherapy. If the radiation therapy destroys the hair follicles, the hair will not grow back. Sleeping with the head of the bed elevated might relieve some intracranial pressure, but it will not prevent increased intracranial pressure from occurring. Analgesic medications for clients with cancer are given on a scheduled basis with a fast-acting analgesic administered PRN for breakthrough pain. Cognitive deterioration does not usually occur. You must be aware of the treatments used for the disease processes to answer this question, but might eliminate option 2 because it violates basic principles of pain management. The nurse is caring for clients in an oncology unit. Which neutropenia precautions should be implemented? 1. Hold all venipuncture sites for at least 5 minutes. 2. Limit fresh fruits and flowers. 3. Place all clients in reverse isolation. 4. Have the clients use a soft bristle toothbrush. The correct answer is 2. Limit fresh fruits and flowers. Fresh fruits and flowers may carry bacteria or insects on the skin of the fruit or dirt on the flowers and leaves, so they are restricted around clients with low white blood cell counts. Option 1 would be done for thrombocytopenia, not neutropenia. Clients with severe neutropenia may be placed in reverse isolation, but not all clients with neutropenia will be placed in reverse isolation. Clients are at a greater risk for infecting themselves from endogenous fungi and bacteria than from being exposed to non-infectious individuals. Option 4 is an intervention for thrombocytopenia. Option 3 has the word all in it, which would make you not select this option. Which are the most serious complications for a child with Kawasaki disease? Select all that apply. 1. Coronary thrombosis. 2. Coronary stenosis. 3. Coronary artery aneurysm. 4. Hypocoagulability. 5. Decreased sedimentation rate. 6. Hypoplastic left heart syndrome. The correct answers are 1. Coronary thrombosis. 2. Coronary stenosis. And 3. Coronary artery aneurysm. Thrombosis, stenosis, and aneurysm affect blood vessels. The child with Kawasaki disease has hypercoagulability and an increased sedimentation rate due to inflammation. Hypoplastic left heart syndrome is a congenital heart defect and has no relation to Kawasaki disease.
The client exhibits a flat affect, psychomotor retardation, and depressed mood. The nurse attempts to engage the client in an interaction, but the client does not respond to the nurse. Which response by the nurse is most appropriate? 1. I'll sit here with you for 15 minutes. 2. I'll come back a little bit later to talk. 3. I'll find someone else for you to talk with. 4. I'll get you something to read. The correct answer is 1. I'll sit here with you for 15 minutes. Rationale. The most appropriate action is for the nurse to remain with the client, even if the client does not engage in conversation with the nurse. A client with severe depression may be unable to engage in an interaction with the nurse because the client feels worthless and lacks the necessary energy to do so. However, the nurse's presence conveys acceptance and caring, thus helping to increase the client's self-worth. Telling the client that the nurse will come back later, stating that the nurse will find someone else for the client to talk with, or telling the client that the nurse will get her something to read conveys to the client that she is not important, reinforcing the client's negative view of herself. Additionally, such statements interfere with the client's development of a sense of security and trust in the nurse.
A 60-year-old comes into the emergency department with crushing substernal chest pain that radiates to the shoulder and left arm. The admitting diagnosis is acute myocardial infarction. Admission prescriptions include oxygen by nasal cannula at 4 liters per minute, complete blood count, a chest radiograph, a 12-lead electrocardiogram, and 2 milligrams of morphine sulfate given IV. The nurse should first 1. Administer the morphine. 2. Obtain a 12-lead ECG. 3. Obtain the blood work. 4. Prescribe the chest radiograph. The correct answer is 1. Administer the morphine. Although obtaining the ECG, chest radiograph, and blood work are all important, the nurse's priority action should be to relieve the crushing chest pain. Therefore, administering morphine sulfate is the priority action. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client, who had a permanent pacemaker implanted 2 days earlier, is being discharged from the hospital. The client understands the discharge plan when the client 1. Selects a low cholesterol diet to control coronary artery disease. 2. States a need for bed rest for 1 week after discharge. 3. Verbalizes safety precautions needed to prevent pacemaker malfunction. 4. Explains signs and symptoms of myocardial infarction. The correct answer is 3. Education is a major component of the discharge plan for a client with an artificial pacemaker. The client with a permanent pacemaker needs to be able to state specific information about safety precautions, such as to refrain from lifting more than 3 pounds or stretching and bending, and to count the pulse once per week that are necessary to maintain proper pacemaker function. The client will not necessarily be placed on a low cholesterol diet. The client should resume activities as he is able and does not need to remain on bed rest. The client should know signs and symptoms of MI, but is not at risk because of the pacemaker. The nurse is preparing a community presentation on oral cancer. Which of the following is a primary risk factor for oral cancer that the nurse should include in the presentation? 1. Use of alcohol. 2. Frequent use of mouthwash. 3. Lack of vitamin B12. 4. Lack of regular teeth cleaning by a dentist. The correct answer is 1. Chronic and excessive use of alcohol can lead to oral cancer. Smoking and use of smokeless tobacco are other significant risk factors. Additional risk factors include chronic irritation such as a broken tooth or ill-fitting dentures, poor dental hygiene, overexposure to sun and syphilis, use of mouthwash, lack of vitamin B12, and lack of regular teeth cleaning appointments have not been implicated as primary risk factors for oral cancer.
The nurse is planning care for a client experiencing agnosia secondary to a cerebrovascular accident. Which collaborative intervention will be included in the plan of care? 1. Observe the client swallowing for possible aspiration. 2. Position the client in a semi-Fowler's position when sleeping. 3. Place a suction setup at the client's bedside during meals. 4. Refer the client to an occupational therapist for evaluation. The correct answer is 4. Refer the client to an occupational therapist for evaluation. A collaborative intervention is an intervention in which another healthcare discipline, in this case occupational therapy, is used in the care of the client. Tetralogy of Fallot involves which defects? Select all that apply. 1. Ventricular septal defect. 2. Right ventricular hypertrophy. 3. Left ventricular hypertrophy. 4. Pulmonic stenosis. 5. Pulmonic atresia. 6. Overriding aorta. 7. Patent ductus arteriosus. The correct answers are 1. Ventricular septal defect. 2. Right ventricular hypertrophy. 4. Pulmonic stenosis. And 6. Overriding aorta. Tetralogy of Fallot is a congenital defect with a ventricular septal defect, right ventricular hypertrophy, pulmonary valve stenosis, and overriding aorta. Pulmonary stenosis causes decreased pulmonary flow. Which statement by the student nurse to the 21-year-old pregnant woman who smokes would require the supervising nurse to intervene? 1. Pregnancy is an excellent time to quit smoking. 2. Vaping instead of smoking during pregnancy is less risky. 3. You should not allow anyone to smoke around you during pregnancy. 4. You should not allow anyone to smoke around the baby when she is born. The correct answer is 2. Vaping instead of smoking during pregnancy is less risky. The nurse would need to intervene to correct erroneous information being given to the patient. Vaping is not safer than smoking in pregnancy. Babies born to mothers who vape have levels of nicotine exposure, low birth weight, and shortened gestational age equal to infants born to mothers who smoke. Clear advice about pregnancy being an excellent time to quit and then providing resources to do so is appropriate education. Advising the mother to avoid secondhand smoke during the pregnancy and after delivery is appropriate advice. The labor and delivery nurse is performing Leopold maneuvers. A soft round mass is felt in the fundal region. A flat object is noted on the left, and small objects are noted on the right of the uterus. A hard round mass is noted above the symphysis. Which of the following positions is consistent with these findings? 1. Left occipital anterior. 2. Left sacral posterior. 3. Right mentum anterior. 4. Right sacral posterior. The correct answer is 1. Left occipital anterior. The nurse's findings upon performing Leopold maneuvers indicate that the fetus is in the left occiput anterior position. That is, the fetal back is felt on the mother's left side. The small parts are felt on her right side. The buttocks are felt in the fundal region, and the head is felt above her symphysis. In the left sacral posterior position, the fetus's buttocks are facing toward the mother's left posterior. A hard round mass is felt in the fundal region, and a soft round mass is felt above the symphysis. In the right mentum anterior position, the fetus's face is facing toward the mother's right anterior, and small objects are felt on the right of the mother's abdomen with a flat area felt on the mother's left side. In the right sacral posterior position, the fetus's sacrum is facing the mother's right posterior, and a hard round mass is felt in the fundal region, while a soft round mass is felt above the symphysis. When during the latent phase of labor, should the nurse assess the fetal heart pattern of a low-risk woman, G1P0000? Select all that apply. 1. After vaginal examinations. 2. Before administration of analgesics. 3. Periodically at the end of a contraction. 4. Every 10 minutes. 5. Before ambulating. The correct answers are 1. After vaginal examinations. 2. Before administration of analgesics. 3. Periodically at the end of a contraction. And 5. Before ambulating. The nurse should assess the fetal heart after all vaginal examinations. The nurse should assess the fetal heart before giving the mother any analgesics. The fetal heart should be assessed periodically at the end of a contraction. The fetal heart pattern should be assessed every hour during the latent phase of a low-risk labor. It is not standard protocol to assess every 10 minutes. The nurse should assess the fetal heart before the woman ambulates. A woman has just arrived at the labor and delivery suite. To report the client's status to her primary healthcare practitioner, which of the following assessments should the nurse perform? Select all that apply. 1. Fetal heart rate. 2. Contraction pattern. 3. Urinalysis. 4. Vital signs. 5. Biophysical profile. The correct answers are 1. Fetal heart rate. 2. Contraction pattern. And 4. Vital signs. The nurse should assess the fetal heart before reporting the client's status to the healthcare provider. The nurse should assess the contraction pattern before reporting the client's status. A complete urinalysis would likely be ordered by the primary healthcare practitioner once the client has been officially admitted, but the test would not be performed during the initial assessment process. The nurse should assess the woman's vital signs before reporting her status. A biophysical profile is performed only if ordered by a healthcare practitioner. A woman who states that she thinks she is in labor enters the labor suite. Which of the following assessments will provide the nurse with the most valuable information regarding the client's labor status? 1. Leopold maneuvers. 2. Fundal contractility. 3. Fetal heart assessment. 4. Vaginal examination. The correct answer is 4. Vaginal examination. Leopold maneuvers, although performed on a woman in labor, assess for fetal position, not the progress of labor. Fundal contractility will assess for uterine contractions, but this is not the most valuable information. Assessment of the fetal heart is critically important in relation to fetal well-being, but it will not determine the progress of labor. A vaginal examination will provide the nurse with the best information about the status of labor. The nurse observes the unlicensed assistive personnel performing delegated tasks. Which action by the UAP requires immediate intervention? 1. The UAP measures the output of a client who had a transurethral resection of the prostate. 2. The UAP tells the client taking bethanechol, whose urine is green, that something must be wrong for the urine to be such an odd color. 3. The UAP encourages the client to drink a glass of water after the nurse has administered the oral antibiotic. 4. The UAP assists the client diagnosed with a urinary tract infection to the bedside commode every 2 hours. The correct answer is 2. The UAP tells the client taking bethanechol, whose urine is green, that something must be wrong for the urine to be such an odd color. A green-blue color indicates the client is taking bethanechol, a urinary stimulant used for clients with a neurogenic bladder. This is an expected color, and the UAP should not indicate that something is wrong with the client. In option 1, the urinary output should be measured frequently in a client who has had a transurethral resection of the prostate. The client will have bladder irrigation, and the indwelling catheter bag will need to be emptied frequently. The nurse would not intervene to stop this action. In option 3, the client should be encouraged to drink fluids. The nurse would not intervene to stop this action. In option 4, this action encourages bowel and urine continence and is part of falls prevention protocol. The nurse would not intervene to stop this action. The client diagnosed with glomerulonephritis is receiving trimethoprim sulfa. Which data indicates the medication is effective? 1. A urine-specific gravity of 1.010. 2. Urinalysis with 35 white blood count high power field. 3. Urine pH of 6.9. 4. A negative urine leukocyte esterase. The correct answer is 4. A negative urine leukocyte esterase. A negative urine leukocyte esterase indicates the antibiotic trimethoprim sulfa is effective in treating the infection. Leukocytes and nitrates are used to determine bacteriuria and other sources of UTIs. Urine-specific gravity can indicate dehydration or water intoxication, but it will not provide information about a UTI. A microscopic value of 35 white blood count high power field indicates a UTI, not that the antibiotic is effective. The normal value is less than 5 WBC HPF. Normal urine pH is 5.0 to 9.0, but the pH does not evaluate a UTI.
A client diagnosed with major depression spends most of the day lying in bed with a sheet pulled over his head. Which of the following approaches by the nurse is most therapeutic? 1. Wait for the client to begin the conversation. 2. Initiate contact with the client frequently. 3. Sit outside the client's room. 4. Question the client until the client responds. The correct answer is 2. Initiate contact with the client frequently. Rationale: the nurse should initiate brief, frequent contacts throughout the day to let the client know that he is important to the nurse. This will positively affect the client's self-esteem. The nurse's action conveys acceptance of the client as a worthwhile person and provides some structure to the seemingly monotonous day. Waiting for the client to begin the conversation with the nurse is not helpful because the depressed client resists interaction and involvement with others. Sitting outside of the client's room is not productive and not necessary in this situation. If the client were actively suicidal, then a one-on-one client-to-staff assignment would be necessary. Questioning the client until he responds would overwhelm him because he could not meet the nurse's expectations to interact.
A client is admitted with a myocardial infarction and atrial fibrillation. While auscultating the heart, the nurse notes an irregular heart rate and hears an extra heart sound at the apex after the S2 that remains constant throughout the respiratory cycle. The nurse should document these findings as 1. Heart rate irregular with S3. 2. Heart rate irregular with S4. 3. Heart rate irregular with aortic regurgitation. 4. Heart rate irregular with mitral stenosis. The correct answer is 1. Heart rate irregular with S3. An S3 heart sound occurs early in diastole as the mitral and tricuspid valves open and blood rushes into the ventricles. To distinguish an S3 from a physiologic S2 split, a split S2 occurs during inspiration and S3 remains constant during the respiratory cycle. Its pitch is softer and best heard with the bell at the apex, and it is one of the first clinical findings in left ventricular failure. An S4 is heard in late diastole when atrial contraction pumps volume into a stiff, non-compliant ventricle. An S4 is not heard in a client with atrial fibrillation because there is no atrial contraction. Murmurs are sounds created by turbulent blood flow through an incompetent or stenotic valve.
An older adult is admitted to the telemetry unit for replacement of a permanent pacemaker because of sinus bradycardia. A priority goal for the client within 24 hours after insertion of a permanent pacemaker is to 1. Maintain skin integrity. 2. Maintain cardiac induction stability. 3. Decrease cardiac output. 4. Increase activity level. The correct answer is 2. Maintaining cardiac induction stability to prevent arrhythmias is a priority immediately after artificial pacemaker implantation. The client should have continuous electrocardiographic monitoring until proper pacemaker functioning is verified. Skin integrity, while important, is not an immediate concern. The pacemaker is used to increase heart rate and cardiac output, not decrease it. The client should limit activity for the first 24 to 48 hours after pacemaker insertion. The client should also restrict movement of the affected extremity for 24 hours. During the assessment of a client's mouth, the nurse notes the absence of saliva. The client reports having pain behind the ear. The client has been nothing by mouth for several days, but now can have liquids. Based on these findings, the nurse should do which of the following? 1. Request a prescription for an antifungal mouthwash. 2. Instruct the client to brush the gums as well as the teeth. 3. Encourage the client to suck on hard candy. 4. Give the client a hydrogen peroxide-based mouthwash. The correct answer is 3. The lack of saliva, pain near the area of the ear, and the prolonged NPO status of the client are indications that the client may be developing parotitis or inflammation of the parotid gland. Parotitis usually develops with dehydration combined with poor oral hygiene, or when clients have been NPO for an extended period. Preventive measures include the use of sugarless hard candy or gum to stimulate saliva production, adequate hydration, and frequent mouth care. The client does not have indications of stomatitis, which produces excessive salivation and a sore mouth. The client does not have indications of oral candidiasis, which causes bluish-white mouth lesions, and a nurse does not need to request a prescription for an antifungal mouthwash. There are no indications that the client has gingivitis, which can be recognized by the inflamed gingiva and bleeding that occurred during toothbrushing, and while the client should brush the teeth and gums, increasing salivation to prevent parotitis is a priority at this time.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with a right-sided cerebrovascular accident is admitted to the rehabilitation unit. Which interventions should be included in the nursing care plan? Select all that apply. 1. Position the client to prevent shoulder adduction. 2. Turn and reposition the client every shift. 3. Encourage the client to move the affected side. 4. Perform quadriceps exercises 3 times a day. 5. Instruct the client to hold the fingers in a fist. The correct answers are 1. Position the client to prevent shoulder adduction, and 3. Encourage the client to move the affected side. Placing a small pillow under the shoulder will prevent the shoulder from adducting toward the chest and developing a contracture. The client should not ignore the paralyzed side, and the nurse must encourage the client to move it as much as possible. A written schedule may assist the client in exercising. A newborn is diagnosed with a congenital heart defect. The test results reveal that the lumen of the duct between the aorta and pulmonary artery remains open. This defect is known as blank. The correct answer is patent ductus arteriosus. This is a defect with increased pulmonary flow. It should close in the first few weeks of life. A nurse is caring for a laboring woman who is in transition. Which of the following signs, symptoms would indicate that the woman is progressing into the second stage of labor? Select all that apply. 1. Bulging perineum. 2. Increased bloody show. 3. Spontaneous rupture of the membranes. 4. Uncontrollable urge to push. 5. Inability to breathe through contractions. The correct answers are 1. Bulging perineum, 2. Increased bloody show, and 4. Uncontrollable urge to push. A bulging perineum indicates progression to the second stage of labor. The bloody show increases as a woman enters the second stage of labor. The amniotic sac can rupture at any time. With a fully dilated cervix and bulging perineum, laboring women usually feel a strong urge to push. The gravita's ability to work with her labor is more dependent on her level of pain and her preparation for labor than on the phases and or stages of labor. The nurse is assessing the fetal station during a vaginal examination. Which of the following structures should the nurse palpate? 1. Sacral promontory. 2. Ischial spines. 3. Cervix. 4. Symphysis pubis. The correct answer is 2. Ischial spines. Palpating the sacral promontory assesses the obstetric conjugate, not the fetal station. Station is assessed by palpating the ischial spines. Palpating the cervix assesses dilation and effacement, not fetal station. Palpating the symphysis, pubis assesses the obstetric conjugate, not the fetal station. While performing Leopold maneuvers on a woman in labor, the nurse palpates a hard round mass in the fundal area, a flat surface on the left side, small objects on the right side, and a soft round mass just above the symphysis. Which of the following is a reasonable conclusion by the nurse? 1. The fetal position is transverse. 2. The fetal presentation is vertex. 3. The fetal lie is vertical. 4. The fetal attitude is flexed. The correct answer is 3. The fetal lie is vertical. With the palpation findings of a hard round mass in the fundal area and soft round mass above the symphysis, the nurse can conclude that the fetal position is not transverse. The nurse can conclude that the fetal lie is vertical. The attitude is difficult to determine when performing Leopold maneuvers. A client in labor, G2P1001, was admitted 1 hour ago at 2 centimeters dilated and 50% effaced. She was talkative and excited at that time. During the past 10 minutes, she has become serious, closing her eyes and breathing rapidly with each contraction. Which of the following is an accurate nursing assessment of the situation? 1. The client had poor childbirth education prior to labor. 2. The client is exhibiting an expected behavior for labor. 3. The client is becoming hypoxic and hypercapnic. 4. The client needs her alpha-fetoprotein levels checked. The correct answer is 2. The client is exhibiting an expected behavior for labor. There is no indication that this woman has had poor preparation for childbirth. The woman is showing expected signs of the active phase of labor. There is no indication that this woman is showing signs of hypoxia and/or hypercapnia. The alpha-fetoprotein assessment is a test to screen for Down syndrome and neural tube defects in the fetus. It is done during pregnancy. A client enters the labor and delivery suite, stating that she thinks she is in labor. Which of the following information about the woman should the nurse note from the woman's prenatal record before proceeding with the physical assessment? Select all that apply. 1. Weight gain. 2. Ethnicity and religion. 3. Age. 4. Type of insurance. 5. Gravidity and parity. The correct answers are 1. Weight gain. 2. Ethnicity and religion. 3. Age. And 5. Gravidity and parity. Before proceeding with a physical assessment, the nurse should check the client's weight gain reported in her prenatal record. The client's ethnicity and religion should be noted before physical assessment. This allows the nurse to proceed in a culturally sensitive manner. The client's age should also be noted before the physical assessment is begun. The type of insurance the woman has is not relevant to the nurse. The client's gravidity and parity, how many times she has been pregnant and how many times she has given birth, should also be noted before a physical assessment is begun. The nurse is administering medications to clients on a urology floor. Which medication should the nurse question? 1. Ceftriaxone to a client who is pregnant. 2. Cephalexin to a client who is allergic to penicillin. 3. Trimethoprim sulfa to a client post-prostate surgery. 4. Nitrofurantoin to a client diagnosed with urinary stasis. The correct answer is 2. Cephalexin to a client who is allergic to penicillin. A cross-sensitivity exists in some clients between penicillin and cephalosporins, such as cephalexin. The nurse should assess the type of reaction that the client experienced when taking penicillin. If the client indicates any symptom of an anaphylactic reaction, the nurse will hold the medication and discuss the situation with the HCP. Ceftriaxone, a third-generation cephalosporin, is in the pregnancy risk category B. No research has shown harm to the fetus in humans or in animals. The nurse would not question this medication. There is no reason for the nurse to question trimethoprim sulfa, a sulfa antibiotic, for a client who has had prostate surgery. There is no reason for the nurse to question nitrofurantoin, a sulfa antibiotic, for a client who has urinary stasis. Nitrofurantoin is used to prevent or treat chronic UTIs. On examination, a nurse hears a murmur at the left sternal border in a child with diarrhea and fever. The parent asks why the healthcare provider never said anything about the murmur. The nurse explains. 1. The healthcare provider is not a cardiologist. 2. Murmurs are difficult to detect, especially in children. 3. The fever increased the intensity of the murmur. 4. We need to refer the child to an interventional cardiologist. The correct answer is 3. The fever increased the intensity of the murmur. The increased CO of the fever increases the intensity of the murmur, making it easier to hear. Option 1 is not a therapeutic response. This child does not need to see an interventional cardiologist. The murmur needs to be diagnosed first, and then a treatment plan would be developed. A 24-year-old Gravida 1, para-0 patient is receiving oxytocin during her labor at 41 weeks gestation. Which nursing actions are appropriate when late fetal heart rate decelerations are identified? Select all that apply. 1. Discontinue the oxytocin. 2. Decrease the maintenance IV fluid rate. 3. Administer oxygen to the mother by mask. 4. Place the woman in high Fowler position. 5. Notify the healthcare provider. 6. Discontinue epidural anesthesia. The correct answers are 1. Discontinue the oxytocin. 3. Administer oxygen to the mother by mask. And 5. Notify the healthcare provider. Late fetal heart rate decelerations can be an ominous sign of fetal hypoxemia, especially if repetitive and accompanied by decreased variability. Notification of the HCP is indicated. Turning off the oxytocin and administering oxygen to the mother are recommended nursing interventions to improve fetal oxygenation. An increase, not a decrease, in the IV rate can improve hydration, correct hypovolemia, and increase blood flow to the uterus. Putting the woman in a lateral position can increase blood flow to the uterus and increase oxygenation to the fetus. The high Fowler position would not be helpful. Discontinuation of epidural anesthesia would not be indicated in the presence of late fetal heart rate decelerations. The anesthesia may be vitally important if the condition continues or worsens and necessitates a cesarean section. Promptly addressing fetal heart rate changes may allow intrauterine resuscitation and may decrease the need for cesarean section if those measures are effective. This supports the perinatal core measure of reducing cesarean section rates. A client with Graves' disease is treated with radioactive iodine in the form of sodium iodide, I-131. Which of the following statements by the nurse will explain to the client how the drug works? 1. The RAI stabilizes the thyroid hormone levels before a thyroidectomy. 2. The RAI reduces uptake of thyroxine and thereby improves your condition. 3. The RAI lowers the levels of thyroid hormones by slowing your body's production of them. 4. The RAI destroys thyroid tissue so that thyroid hormones are no longer produced. The correct answer is 4. The RAI destroys thyroid tissue so that thyroid hormones are no longer produced. Sodium iodide, I-131, destroys the thyroid follicular cells, and thyroid hormones are no longer produced. RAI is commonly recommended for clients with Graves' disease, especially the elderly. The treatment results in a medical thyroidectomy. RAI is given in lieu of surgery, not before surgery. RAI does not reduce uptake of thyroxine. The outcome of giving RAI is the destruction of the thyroid follicular cells. It is possible to slow the production of thyroid hormones with RAI.
An adolescent with chest pain goes to the school nurse. The nurse determines that the teenager has a history of asthma, but has had no problem for years. Which of the following should the nurse do next? 1. Call the adolescent's parent. 2. Have the adolescent lie down for 30 minutes. 3. Obtain a peak flow reading. 4. Give 2 puffs of a short-acting bronchodilator. The correct answer is 3. Problems of chest pain in children and adolescents are rarely cardiac. With a history of asthma, the most likely cause of the chest pain is related to the asthma. Therefore, the nurse should check the adolescent's peak flow reading to evaluate the status of the airflow. Calling the adolescent's parent will be appropriate. But this will be done after the nurse obtains a peak flow reading and additional assessment data. Having the adolescent lie down may be an option, but more data need to be collected to help establish a possible cause. Because the adolescent has not experienced any asthma problems for a long time, it would be inappropriate for the nurse to administer a short-acting bronchodilator at this time.
A client is admitted to the hospital with a diagnosis of cholecystitis from cholelithiasis. The client has severe abdominal pain and nausea and has vomited several times. Based on these data, which nursing action would have the highest priority for intervention at this time? 1. Manage anxiety. 2. Restore fluid loss. 3. Manage the pain. 4. Replace nutritional loss. The correct answer is 3. Manage the pain. The priority for nursing care at this time is to decrease the client's severe abdominal pain. The pain, which is frequently accompanied by nausea and vomiting, is caused by biliary spasm. Opioid analgesics are given to relieve the severe pain and spasm of cholecystitis. Relief of pain may decrease nausea and vomiting and thereby decrease the client's likelihood of developing further complications, such as severe fluid loss and inadequate nutrition. There are no data to suggest that the client is anxious. Which statement best describes the scientific rationale for administering aluminum hydroxide to a client diagnosed with chronic kidney disease? 1. This medication neutralizes gastric acid production. 2. It binds to phosphorus to help decrease hyperphosphatemia. 3. The medication is administered to decrease the calcium level. 4. It will help decrease episodes of constipation in the client with CKD. The correct answer is 2. It binds to phosphorus to help decrease hyperphosphatemia. Clients with CKD experience an increase in serum phosphorus levels, and administering aluminum hydroxide, an antacid, binds with phosphorus to be excreted in the feces. Option 1 is the scientific rationale for administering antacids to clients with peptic ulcer disease or gastritis, not clients with CKD. Aluminum hydroxide does not affect the calcium level. Aluminum hydroxide can cause constipation. It is not used to treat constipation.
The nurse is planning care with a Mexican client who is diagnosed with depression. The client believes in Mal Oyo, the evil eye, and uses treatment by a root healer. The nurse should do which of the following? 1. Avoid talking to the client about the root healer. 2. Explain to the client that Western medicine has a scientific, not mystical, basis. 3. Explain that such beliefs are superstitious and should be forgotten. 4. Involve the root healer in a consultation with the client, primary healthcare provider, and nurse. The correct answer is for involve the root healer in a consultation with the client, primary healthcare provider, and nurse. Rationale. Including the root healer gives credibility and respect to the client's cultural beliefs. Avoiding talking about the healer demonstrates either ignorance or disregard for the client's cultural values. Negative comparison of root healing with Western medicine not only denigrates the client's beliefs, but is likely to alienate and cause the client to end treatment.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client with a head injury is admitted into the intensive care unit. Which HCP medication order should the ICU nurse question? Select all that apply. 1. Morphine. 2. Mannitol. 3. Methylprednisolone. 4. Phenytoin. 5. Oxygen. The correct answers are 1. Morphine and 3. Methylprednisolone. Administering narcotics to clients with head injuries may mask signs of increased intracranial pressure, so the nurse questioning this medication would be appropriate. Research supports the finding that clients with head injuries who are treated with anti-inflammatory corticosteroids are 20% more likely to die within 2 weeks after the head injury than those who aren't treated. The nurse should question this medication. The client with a head injury is ordered a CT scan of the head with contrast dye. Which statements by the client warrant immediate intervention? Select all that apply. 1. I take atenolol for my high blood pressure. 2. I am allergic to many types of fish. 3. I get nauseated whenever I take aspirin. 4. I am taking metformin for my diabetes. 5. I had about 3 beers before I fell and hit my head. The correct answers are 2. I am allergic to many types of fish, and 4. I am taking metformin for my diabetes. The contrast dye used in a CT scan is iodine-based, and an allergy to shellfish suggests an allergy to iodine and would warrant the nurse notifying the HCP to cancel the contrast part of the CT scan. Further assessment would be needed. Metformin, a biguanide medication used for control of diabetes, must not be taken because the kidneys remove metformin. Contrast medium can greatly increase the level of metformin in the blood because damaged kidneys are not as effective at removing metformin from the body. The following clients have a head injury. Which clients should the nurse question administering the medication mannitol? Select all that apply. 1. The 34-year-old client who is HIV positive. 2. The 84-year-old client who has glaucoma. 3. The 68-year-old client who has cor pulmonale. 4. The 16-year-old client who has cystic fibrosis. 5. The 58-year-old client with congestive heart failure. The correct answers are 3. The 68-year-old client who has cor pulmonale, and 5. The 58-year-old client with congestive heart failure. Cor pulmonale is right-sided heart failure, often secondary to chronic obstructive pulmonary disease. Because mannitol pulls fluid off the brain, it may lead to a circulatory overload, which the heart with right-sided failure could not handle. This client would need an order for a loop diuretic to prevent serious cardiac complications. Because the osmotic diuretic mannitol pulls fluid off the brain, it may lead to a circulatory overload, which the client in CHF could not handle. This client would need an order for a loop diuretic to prevent serious cardiac complications. The client with increased intracranial pressure is receiving mannitol. Which data would cause the nurse to hold the administration of this medication? 1. The serum osmolality is 330 milliosmoles per kilogram. 2. The urine osmolality is 550 milliosmoles per kilogram. 3. The blood urea nitrogen level is 8 milligrams per deciliter. 4. The creatinine level is 1.8 milligrams per deciliter. The correct answer is 1. The serum osmolality is 330 milliosmoles per kilogram. The normal serum osmolality is 275 to 300 milliosmoles per kilogram. The osmotic diuretic mannitol is held if the serum osmolality exceeds 310 to 320 milliosmoles per kilogram. The nurse is caring for the following clients. Which client would the nurse assess first after receiving the shift report? 1. The 22-year-old male client diagnosed with a concussion who is complaining someone is waking him up every 2 hours. 2. The 36-year-old female client admitted with complaints of left-sided weakness who is scheduled for a magnetic resonance imaging scan. 3. The 45-year-old client admitted with blunt trauma to the head after a motorcycle accident who has a Glasgow Coma Scale score of 6. 4. The 62-year-old client diagnosed with a cerebrovascular accident who has expressive aphasia. The correct answer is 3. The 45-year-old client admitted with blunt trauma to the head after a motorcycle accident who has a Glasgow Coma Scale score of 6. The Glasgow Coma Scale is used to determine a client's response to stimuli, eye-opening response, best verbal response, and best motor response, secondary to a neurological problem. Scores range from 3 to 15. The client diagnosed with a mild concussion is being discharged from the emergency department. Which discharge instruction should the nurse teach the client's significant other? 1. Awaken the client every 2 hours. 2. Monitor for increased intracranial pressure. 3. Observe frequently for hypervigilance. 4. Offer the client food every 3 to 4 hours. The correct answer is 1. Awaken the client every 2 hours. Awakening the client every 2 hours allows the identification of headache, dizziness, lethargy, irritability, and anxiety, all signs of post-concussion syndrome that would warrant the significant others taking the client back to the emergency department. For the child with hypoplastic left heart syndrome, which drug may be given to allow the patent ductus arteriosus to remain open until surgery? Blank. The correct answer is prostaglandin E. Prostaglandin E maintains ductal patency to promote blood flow until the Norwood procedure is begun. Consider the opposite of wanting to close the patent ductus arteriosus. The nurse is caring for a patient in labor at 39 weeks gestation and has identified mild variable fetal heart rate decelerations. Which action would the nurse take first? 1. Change the maternal position. 2. Notify the healthcare provider. 3. Prepare for delivery. 4. Readjust the fetal monitor. The correct answer is 1. Change the maternal position. The cause of variable fetal heart decelerations is compression of the umbilical cord, which can often be corrected by a change in maternal position. It is usually a benign condition and would not require the nurse to prepare for delivery or to notify the healthcare provider unless the variable decelerations are severe and persistent. Adjusting the fetal monitor may be needed after the change in maternal position, but would not directly address the variable decelerations. The nurse should teach the client with Graves' disease to prevent corneal irritation from mild exophthalmos by 1. Massaging the eyes at regular intervals. 2. Instilling an ophthalmic anesthetic as prescribed. 3. Wearing dark-colored glasses. 4. Covering both eyes with moistened gauze pads. The correct answer is 3. Wearing dark-colored glasses. Treatment of mild ophthalmopathy that may accompany thyrotoxicosis includes measures such as wearing sunglasses to protect the eyes from corneal irritation. Treatment of ophthalmopathy should be performed in consultation with an ophthalmologist. Massaging the eyes will not help to protect the cornea. An ophthalmic anesthetic is used to examine and possibly treat a painful eye, not protect the cornea. Covering the eyes with moist gauze pads is not a satisfactory nursing measure to protect the eyes of a client with exophthalmos because treatment is not focused on moisture to the eye, but rather on protecting the cornea and optic nerve. In exophthalmos, the retrobulbar connective tissues and extraocular muscle volume are expanded because of fluid retention. The pressure is also increased.
A 10-year-old child who is 5'4" tall with a history of asthma uses an inhaled bronchodilator only when needed. She takes no other medications routinely. Her best peak expiratory flow rate is 270 liters per minute. The child's current peak flow reading is 180 liters per minute. The nurse interprets this reading as indicating which of the following? 1. The child's asthma is under good control, so the routine treatment plan should continue. 2. The child needs to use her short-acting inhaled beta-2 agonist medication. 3. This is a medical emergency, requiring a trip to the emergency department for treatment. 4. The child needs to use her inhaled cromolyn sodium. The correct answer is 2. The peak flow of 180 liters per minute is in the yellow zone, or 50% to 80% of the child's personal best. This means that the child's asthma is not well controlled, thereby necessitating the use of a short-acting beta-2 agonist medication to relieve the bronchospasm. A peak flow reading greater than 80% of the child's personal best would indicate that the child's asthma is in the green zone or under good control. A peak flow reading in the red zone, or less than 50% of the child's personal best, would require notification of the healthcare provider or a trip to the emergency department. Cromolyn sodium is not used for short-term treatment of acute bronchospasm. It is used as part of a long-term therapy regimen to help desensitize mast cells and thereby help to prevent symptoms.
The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm on the monitor. See the electrocardiogram strip below. The nurse should 1. Notify the physician. 2. Call the rapid response team. 3. Assess the client for changes in the rhythm. 4. Administer lidocaine as prescribed. The correct answer is 3. Assess the client for changes in the rhythm. The client is experiencing a single PVC. PVCs are characterized by a QRS of longer than 0.12 second and by a wide, notched, or slurred QRS complex. There is no P wave related to the QRS complex, and the T wave is usually inverted. PVCs are potentially serious and can lead to ventricular fibrillation or cardiac arrest when they occur more than 6 to 10 in an hour in clients with myocardial infarction. The nurse should continue to monitor the client and note if the PVCs are increasing. It is not necessary to notify the physician or call the rapid response team at this point. Lidocaine is not indicated from the data on this ECG. Which intervention should the nurse implement when administering epoetin subcutaneously? Select all that apply. 1. Do not shake the vial prior to preparing the injection. 2. Apply a warm washcloth after administering the medication. 3. Discard any unused portion of the vial after pulling up the correct dose. 4. Keep the medication vials in the refrigerator until preparing to administer. 5. Administer the medication intramuscularly in the deltoid muscle. The correct answers are 1. Do not shake the vial prior to preparing the injection. 3. Discard any unused portion of the vial after pulling up the correct dose. And 4. Keep the medication vials in the refrigerator until preparing to administer. Do not shake the vial because shaking may denature the biological response modifier, epoetin, rendering it biologically inactive. The nurse should only use the vial for one dose. The nurse should not re-access the vial and should discard any unused portion because the vial contains no preservatives. The medication should be stored in the refrigerator and should be warmed to room temperature prior to its being administered. The nurse should apply ice to numb the injection site, not a warm washcloth after administration. This injection is administered subcutaneously, not intramuscularly. The client with increased intracranial pressure is receiving mannitol. Which intervention should the nurse implement to evaluate the effectiveness of the medication? 1. Monitor the client's vital signs. 2. Maintain strict intake and output. 3. Assess the client's neurological status. 4. Check the client's serum osmolality level. The correct answer is 3. Assess the client's neurological status. Mannitol, an osmotic diuretic, is administered to decrease intracranial pressure. Changes in intracranial pressure affect neurological status. Therefore, the client's neurological status should be evaluated to determine the effectiveness of the medication. The nurse is preparing to administer medications to the following clients. Which medication should the nurse question administering? 1. Furosemide to a client with a serum potassium level of 4.2 milliequivalents per liter. 2. Mannitol to a client with a serum osmolality of 280 milliosmol per kilogram. 3. Digoxin to a client with a digoxin level of 2.4 nanograms per milliliter. 4. Phenytoin to a client with a phenytoin level of 14 microgram per milliliter. The correct answer is 3. Digoxin to a client with a digoxin level of 2.4 nanograms per milliliter. The normal digoxin level is 0.8 to 2.0 nanograms per milliliter. A digoxin level of 2.4 nanograms per milliliter would warrant the nurse questioning the administration of this medication. The trade name for digoxin is Lanoxin, and the classification is cardiac glycoside. The client has an open laceration on the right temporal lobe secondary to being hit on the head with a baseball bat. The emergency department's HCP sutures the laceration, and the CT scan is negative. Which instruction should the nurse discuss with the client? 1. Do not put anything on the laceration for 72 hours. 2. Use hydrocortisone cream 0.5% on the laceration. 3. Cleanse the area with alcohol 3 times a day. 4. Apply a topical antibiotic ointment to the sutured area. The correct answer is 4. Apply a topical antibiotic ointment to the sutured area. The sutured area must be cleansed with soap and water and patted dry, and an antibiotic ointment, such as Neosporin, should be applied to prevent infection. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which discharge instructions should the emergency room nurse discuss with the client who has sustained a concussion? Select all that apply. 1. Do not drink any type of alcoholic beverage until allowed by the HCP. 2. Take 2 acetaminophen up to every 6 hours for a headache. 3. If experiencing a headache, take 1 hydrocodone every 8 hours. 4. It is all right to take a couple of aspirin if experiencing a headache. 5. Notify the HCP if the medication does not relieve your headache. The correct answers are 1. Do not drink any type of alcoholic beverage until allowed by the HCP. 2. Take 2 acetaminophen up to every 6 hours for a headache. And 5. Notify the HCP if the medication does not relieve your headache. Traumatic brain injuries can impair many brain functions that can be significantly worsened by alcohol, so the client should not drink alcoholic beverages until allowed by the HCP. Acetaminophen, a non-narcotic analgesic, can be taken for a headache in a patient who has sustained a concussion. If acetaminophen does not relieve the client's headache, then the client should notify the HCP because this may indicate a worsening condition, such as increased intracranial pressure. The client with a head injury is experiencing increased intracranial pressure. The neurosurgeon prescribes mannitol. Which intervention should the nurse implement when administering this medication? 1. Monitor the client's arterial blood gases during administration. 2. Do not administer if the client's blood pressure is less than 90/60. 3. Ensure that the client's cardiac status is monitored by telemetry. 4. Use a filter needle when administering the medication. The correct answer is 4. Use a filter needle when administering the medication. The nurse must use a filter needle when administering the osmotic diuretic mannitol because crystals may form in the solution and syringe and be inadvertently injected into the client if a filter needle is not used. The resident in a long-term care facility fell during the previous shift and has a laceration in the occipital area that has been closed with steri strips. Which signs/symptoms would warrant transferring the resident to the emergency department? 1. A 4 centimeters area of bright red drainage on the dressing. 2. A weak pulse, shallow respirations, and cool, pale skin. 3. Pupils that are equal, react to light, and accommodate. 4. Complaints of a headache that resolves with medication. The correct answer is 2. A weak pulse, shallow respirations, and cool, pale skin. These signs, symptoms, weak pulse, shallow respirations, cool, pale skin, indicate increased intracranial pressure from cerebral edema secondary to the fall, and they require immediate attention. A client diagnosed with a subarachnoid hemorrhage has undergone a craniotomy for repair of a ruptured aneurysm. Which intervention will the intensive care nurse implement? 1. Administer a stool softener, BID. 2. Encourage the client to cough hourly. 3. Monitor neurological status every shift. 4. Maintain the dopamine drip to keep blood pressure at 160/90. The correct answer is 1. Administer a stool softener, BID. The client is at risk for increased intracranial pressure whenever performing the Valsalva maneuver, which will occur when straining during defecation. Therefore, stool softeners would be appropriate.
A 16-year-old client is prescribed 10 milligrams of paroxetine at bedtime for major depression. The nurse should instruct the client and parents to monitor the client closely for which adverse effect: 1. Headache. 2. Nausea. 3. Fatigue. 4. Agitation. The correct answer is 4. Agitation. Rationale. The nurse closely monitors the client taking paroxetine for the development of agitation, which could lead to a self-deletion attempt. Headache, nausea, and fatigue are transient adverse effects of paroxetine.
The nurse notices that a client's heart rate decreases from 63 to 50 beats per minute on the monitor. The nurse should first: 1. Administer atropine 0.5 milligrams IV push. 2. Auscultate for abnormal heart sounds. 3. Prepare for transcutaneous pacing. 4. Take the client's blood pressure. The correct answer is 4. Take the client's blood pressure. The nurse should first assess the client's tolerance to the drop in heart rate by checking the blood pressure and level of consciousness and determine if atropine is needed. If the client is symptomatic, atropine and transcutaneous pacing are interventions for symptomatic bradycardia. Once the client is stable, further physical assessments can be done.
A client is scheduled for the insertion of an implantable cardioverter defibrillator, ICD. The spouse expresses anxiety about what would happen if the device discharges during physical contact. The nurse should tell the spouse: 1. Physical contact should be avoided whenever possible. 2. They will not feel the countershock. 3. The shock will be felt, but it would not cause any harm. 4. A warning device sound before countershock, so there is time to move away. The correct answer is 4. An implanted defibrillator always provides at least 3 beeps before delivering a countershock, and the nurse should tell the spouse to move away when they hear those beeps. The spouse can have physical contact with the client, but if the ICD were to discharge while the spouse had contact with the client, the spouse would feel the shock and could also be harmed. The spouse will feel the countershock if touching the client, and it would harm the spouse. Amoxicillin trihydrate 300 milligrams PO has been prescribed for a client with an oral infection. The medication is available in a liquid suspension that is available as 250 milligrams per 5 milliliters. How many milliliters should the nurse administer? Blank ml. The correct answer is 6 milliliters. The formula is 300 milligrams over X ml equal to 250 milligrams over 5 milliliters. You cross-multiply and get 250x equals to 1500. You divide by 250 on both sides, and you get 6 milliliters.
Which client would the nurse identify as being most at risk for experiencing a CVA? 1. A 55-year-old African-American male. 2. An 84-year-old Japanese female. 3. A 67-year-old Caucasian male. 4. A 39-year-old pregnant female. The correct answer is 1. A 55-year-old African-American male. African Americans have twice the rate of CVAs as Caucasians, and men have a higher incidence than women. African Americans suffer more extensive damage from a CVA than do people of other cultural groups. What can an electrocardiogram detect? Select all that apply. 1. Ischemia. 2. Injury. 3. Cardiac output. 4. Dysrhythmias. 5. Systemic vascular resistance. 6. Occlusion pressure. 7. Conduction delay. The correct answers are 1. Ischemia. 2. Injury. 4. Dysrhythmias. 7. Conduction delay. An electrocardiogram can indicate ischemia of the heart muscle. An electrocardiogram can indicate injury to the heart muscle. An electrocardiogram can show dysrhythmias. An electrocardiogram does show conduction delays. An electrocardiogram does not indicate cardiac output. An electrocardiogram does not show systemic vascular resistance. An electrocardiogram does not show occlusion pressures. The electrocardiogram checks the electrical system of the heart, not the mechanical system. Cardiac output is mechanical. Occlusion pressure does not have to do with the electrocardiogram, and systemic vascular resistance measures pressures in the peripheral system. An 18-month-old child has oral mucositis secondary to chemotherapy. Which task should the nurse delegate to the assistive personnel? 1. Reporting evidence of severe mucosal ulceration. 2. Assisting the child in swishing and spitting mouthwash. 3. Assessing the child's ability and willingness to drink through a straw. 4. Feeding the child a bland, moist, soft diet. The correct answer is 4. Feeding the child a bland, moist, soft diet. Helping the child to eat is within the scope of responsibilities for an AP. Assessing ability and willingness to drink and checking for extent of mucosal ulceration are the responsibilities of a nurse. An 18-month-old child is not able to swish and spit, which could result in swallowing the mouthwash. Mouthwash is not intended for swallowing because it can contain alcohol and other ingredients not safe for ingestion.
A school-age child with cystic fibrosis asks the nurse what sports she can become involved in as she becomes older. Which of the following activities would be appropriate for the nurse to suggest? 1. Swimming. 2. Track. 3. Baseball. 4. Javelin throwing. The correct answer is 1. Swimming would be the most appropriate suggestion because it coordinates breathing and movement of all muscle groups and can be done on an individual basis or as a team sport. Because track events, baseball, and javelin throwing usually are performed outdoors, the child would be breathing in large amounts of dust and dirt, which would be irritating to her mucous membranes and pulmonary system. The strenuous activity and increased energy expenditure associated with track events, in conjunction with the dust and possible heat, would play a role in placing the child at risk for an upper respiratory tract infection and compromising her respiratory function. Which of the following, if described by the parents of a child with cystic fibrosis, indicates that the parents understand the underlying problem of the disease? 1. An abnormality in the body's mucus-secreting glands. 2. Formation of fibrous cysts in various body organs. 3. Failure of the pancreatic ducts to develop properly. 4. Reaction to the formation of antibodies against streptococcus. The correct answer is 1. CF is characterized by a dysfunction in the body's mucus-producing exocrine glands. The mucus secretions are thick and sticky rather than thin and slippery. The mucus obstructs the bronchi, bronchioles, and pancreatic ducts. Mucus plugs in the pancreatic ducts can prevent pancreatic digestive enzymes from reaching the small intestine, resulting in poor digestion and poor absorption of various food nutrients. Fibrous cysts do not form in various organs. Cystic fibrosis is an autosomal recessive inherited disorder and does not involve any reaction to formation of antibodies against streptococcus. At a follow-up appointment after being hospitalized, an adolescent with a history of cystic fibrosis describes his stools to the nurse. Which of the following descriptions should the nurse interpret as indicative of continued problems with malabsorption? 1. Soft with little odor. 2. Large and foul-smelling. 3. Loose with bits of food. 4. Hard with streaks of blood. The correct answer is 2. In children with CF, poor digestion and absorption of foods, especially fats, results in frequent bowel movements that are bulky, large, and foul-smelling. The stools also contain abnormally large quantities of fat, which is called steatorrhea. An adolescent experiencing good control of the disease would describe soft stools with little odor. Stool described as loose with bits of food indicates diarrhea. Stool described as hard with streaks of blood may indicate constipation. When developing a plan of care for a child with cystic fibrosis who is scheduled to receive postural drainage, the nurse should anticipate performing postural drainage at which of the following times? 1. After meals. 2. Before meals. 3. After rest periods. 4. Before inhalation treatments. The correct answer is 2. Postural drainage, which aids in mobilizing the thick, tenacious secretions commonly associated with CF, is usually performed before meals to avoid the possibility of vomiting or regurgitating food. Although the child with CF needs frequent rest periods, this is not an important factor in scheduling postural drainage. However, the nurse would not want to interrupt the child's rest period to perform the treatment. Inhalation treatments are usually given before postural drainage to help loosen secretions.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse has been assigned to provide care for 4 clients. In what order should the nurse assess these clients? 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair fractured jaw. The correct order is 3, 4, 2, and 1. The client with peptic ulcer disease who is experiencing a sudden onset of acute stomach pain should be assessed first by the nurse. The sudden onset of stomach pain could be indicative of a perforated ulcer, which would require immediate medical attention. It is also important for the nurse to thoroughly assess the nature of the client's pain. The client with a fractured jaw is experiencing pain and should be assessed next. The nurse should then assess the client who is NPO for tests to ensure NPO status and comfort. Last, the nurse can assess the client before surgery.
The 85-year-old client diagnosed with a stroke is complaining of a severe headache. Which intervention should the nurse implement first? 1. Administer a non-narcotic analgesic. 2. Prepare for stat magnetic resonance imaging. 3. Start an intravenous infusion with D5W at 100 milliliters per hour. 4. Complete a neurological assessment. The correct answer is 4. Complete a neurological assessment. The nurse must complete a neurological assessment to help determine the cause of the headache before taking any further action. Which interventions decrease cardiac demands in an infant with congestive heart failure? Select all that apply. 1. Allow parents to hold and rock their child. 2. Feed only when the infant is crying. 3. Keep the child uncovered to promote low body temperature. 4. Make frequent position changes. 5. Feed the child when sucking the fists. 6. Change bed linens only when necessary. 7. Organize nursing activities. The correct answers are 1. Allow parents to hold and rock their child. 4. Make frequent position changes. 5. Feed the child when sucking the fists. 6. Change bed linens only when necessary. And 7. Organize nursing activities. Rocking by the parents will comfort the infant and decrease demands. Frequent position changes will decrease the risk for infection by avoiding immobility with its potential for skin breakdown. An infant sucking the fists could indicate hunger. Change bed linens only when necessary to avoid disturbing the child. Organize nursing activities to avoid disturbing the child. The infant would not be fed when crying because crying increases cardiac demands. The infant might choke if the nipple is placed in the mouth and the child inhales when trying to swallow. Keep the child normothermic to reduce metabolic demands. The telephone triage nurse in the prenatal clinic receives the following calls. Which telephone call would require immediate notification of the healthcare provider? 1. Patient reports leaking vaginal fluid at 34 weeks gestation. 2. Patient reports nausea and vomiting at 8 weeks gestation. 3. Patient reports pedal edema at 39 weeks gestation. 4. Patient reports vaginal itching at 20 weeks gestation. The correct answer is 1. Patient reports leaking vaginal fluid at 34 weeks gestation. Leaking vaginal fluid at 34 weeks gestation requires immediate attention because it could indicate premature rupture of membranes with the risk of premature birth. A nurse in a prenatal clinic can safely give telephone advice regarding nausea, vomiting, and pedal edema, which can be considered normal in pregnancy. The nurse would assess the complaint, give the patient evidence-based advice, and define the circumstances under which the patient should call back. Vaginal itching at 20 weeks gestation could indicate a yeast infection. Depending on clinic protocols, the nurse could, after phone assessment, safely recommend an over-the-counter medication or arrange an office visit for the patient. A client with thyrotoxicosis says to the nurse, "I am so irritable. I am having problems at work because I lose my temper very easily." Which of the following responses by the nurse would give the client the most accurate explanation of her behavior? 1. Your behavior is caused by temporary confusion brought on by your illness. 2. Your behavior is caused by the excess thyroid hormone in your system. 3. Your behavior is caused by your worrying about the seriousness of your illness. 4. Your behavior is caused by the stress of trying to manage a career and cope with illness. The correct answer is 2. Your behavior is caused by the excess thyroid hormone in your system. A typical sign of thyrotoxicosis is irritability caused by the high levels of circulating thyroid hormones in the body. This symptom decreases as the client responds to therapy. Thyrotoxicosis does not cause confusion. The client may be worried about her illness, and stress may influence her mood. However, irritability is a common symptom of thyrotoxicosis, and the client should be informed of that fact rather than blamed.
When preparing the teaching plan for the mother of a child with asthma, which of the following should the nurse include as signs to alert the mother that her child is having an asthma attack? 1. Secretion of thin, copious mucus. 2. Tight, productive cough. 3. Wheezing on expiration. 4. Temperature of 99.4 degrees Fahrenheit. The correct answer is 3. The child who is experiencing an asthma attack typically demonstrates wheezing on expiration initially. This results from air moving through narrowed airways secondary to bronchoconstriction. The child's expiratory phase is normally longer than the inspiratory phase. Expiration is passive as the diaphragm relaxes. During an asthma attack, secretions are thick and are not usually expelled until bronchioles are more relaxed. At the beginning of an asthma attack, the cough will be tight, but not productive. Fever is not always present unless there is an infection that may have triggered the attack.
A client is receiving an IV infusion of heparin sodium at 1,200 units per hour. The dilution is 25,000 units per 500 milliliters. How many milliliters per hour will this client receive? The correct answer is 24 milliliters per hour. To solve this problem, first, calculate how many units are in each milliliter of the medication. The questions gives us 25,000 units per 500 milliliters. 25,000 units divided by 500 equals to 50 units. 500 milliliters divided by 500 equals to 1 milliliter. So it's 50 units per 1 milliliter. Next, calculate how many milliliters the client receives per hour. Since the client is receiving 1,200 units per hour and there is 50 units per 1 milliliter, we divide 1,200 by 50, which equals to 24. So the client is receiving 24 milliliter per hour.
Parents bring their child to the emergency department because the child has stopped breathing. A nurse obtains a brief history of events occurring before and after the parents found the infant not breathing. Which of the following questions should the nurse ask the parents first? 1. Was the infant sleeping while wrapped in a blanket? 2. Was the infant lying on his stomach? 3. What did the infant look like when you found him? 4. When had you last checked on the infant? The correct answer is 3. Because this is an especially disturbing and upsetting time for the parents, they must be approached in a sensitive manner. Asking what the infant looked like when found allows the parents to verbalize what they saw and felt, thereby helping to minimize their feelings of guilt without implying any blame, neglect, wrongdoing, or abuse. Asking if the child was wrapped in a blanket or lying on his stomach, or when the parents last checked on the infant, implies that the parents did something wrong or failed in their care of the infant, thus blaming them for the event. When explaining to parents how to reduce the risk of sudden infant death syndrome, the nurse should teach about which of the following measures. Select all that apply. 1. Maintain a smoke-free environment. 2. Use a wedge for sideline positions. 3. Breastfeed the baby. 4. Place the baby on his back to sleep. 5. Use bumper pads over the bed rails. 6. Have the baby sleep in the parent's bed. The correct answers are 1, 3, and 4. Exposure to environmental tobacco increases the risk for SIDS. Sleeping on the back and breastfeeding both decrease the risk of SIDS. The sideline position is not recommended for sleep. It is recommended that babies be dressed in sleepers and that cribs are free of blankets, pillows, bumper pads, and stuffed animals. Co-bedding with parents is not recommended as parents may roll on the child. Which of the following outcome criteria would a nurse develop for a child with cystic fibrosis who has ineffective airway clearance related to increased pulmonary secretions and inability to expectorate? 1. Respiratory rate and rhythm within expected range. 2. Absence of chills and fever. 3. Ability to engage in age-related activities. 4. Ability to tolerate usual diet without vomiting. The correct answer is 1. After treatment, the client outcome would be that respiratory status would be within normal limits, as evidenced by a respiratory rate and rhythm within expected range. Absence of chills and fever, although related to an underlying problem causing the respiratory problem, do not specifically relate to the respiratory problem of ineffective airway clearance. The child's ability to engage in age-related activities may provide some evidence of improved respiratory status. However, this outcome criterion is more directly related to activity intolerance. Although the child's ability to tolerate his or her usual diet may indirectly relate to respiratory function, this outcome is more specifically related to an imbalanced nutrition that may or may not be related to the child's respiratory status. When developing a recreational therapy plan of care for a 3-year-old child hospitalized with pneumonia and cystic fibrosis, which of the following toys would be appropriate? 1. 100-piece jigsaw puzzle. 2. Child's favorite doll. 3. Fuzzy stuffed animal. 4. Scissors, paper, and paste. The correct answer is 2. The child's favorite doll will be a good choice of toys. The doll provides support and is familiar to the child. Although a 3-year-old may enjoy puzzles, a 100-piece jigsaw puzzle is too complicated for an ill 3-year-old child. In view of the child's lung pathology, a fuzzy stuffed animal would not be advised because of its potential as a reservoir for dust and bacteria, possibly predisposing the child to additional respiratory problems. Scissors, paper, and paste are not appropriate for a 3-year-old unless the child is supervised closely. When teaching the parents of an older infant with cystic fibrosis about the type of diet the child should consume, which of the following would be appropriate? 1. Low-protein diet. 2. High-fat diet. 3. Low-carbohydrate diet. 4. High-calorie diet. The correct answer is 4. CF affects the exocrine glands. Mucus is thick and tenacious, sticking to the walls of the pancreatic and bile ducts and eventually causing obstruction. Because of the difficulty with digestion and absorption, a high-calorie, high-protein, high-carbohydrate, moderate-fat diet is indicated. A child with cystic fibrosis is receiving gentamicin. Which of the following nursing actions is most important? 1. Monitoring intake and output. 2. Obtaining daily weights. 3. Monitoring the client for indications of constipation. 4. Obtaining stool samples for hemical testing. The correct answer is 1. Monitoring intake and output is the most important nursing action when administering an aminoglycoside, such as gentamicin, because a decrease in output is an early sign of renal damage. Daily weight monitoring is not indicated when the client is receiving an aminoglycoside. Constipation and bleeding are not adverse effects of aminoglycosides.
The nurse measures the amount of bile drainage from a T-tube and records it by which one of the following methods? 1. Adding it to the client's urine output. 2. Charting it separately on the output record. 3. Adding it to the amount of wound drainage. 4. Subtracting it from the total intake for each day. The correct answer is 2. Charting it separately on the output record. T-tube bile drainage is recorded separately on the output record. Adding the T-tube drainage to the urine output or wound drainage makes it difficult to accurately determine the amounts of bile, urine, or drainage. The client's total intake will be incorrect if drainage is subtracted from it. The client diagnosed with chronic kidney disease on hemodialysis is prescribed lanthanum carbonate. Which interventions should the nurse discuss with the client? Select all that apply. 1. Chew the tablets completely before swallowing. 2. Monitor the dialysis graft for bleeding. 3. Take an over-the-counter proton pump inhibitor. 4. Check the radial pulse prior to taking the medication. 5. Take the medication with or right after meals. The correct answers are 1. Chew the tablets completely before swallowing, and 5. Take the medication with or right after meals. Lanthanum carbonate, an electrolyte and water balancing agent, should not be swallowed. The medication must be chewed for absorption in the intestines. Lanthanum carbonate should be taken with or right after meals. Lanthanum carbonate may cause graft occlusion, not bleeding. Lanthanum carbonate does not increase gastric acid secretion. Therefore, the client would not need to take a proton pump inhibitor. Lanthanum carbonate may cause hypotension, and the blood pressure must be checked, not the pulse rate. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is reviewing the laboratory report with the client's lithium level taken that morning prior to administering the 5 p.m. dose of lithium. The lithium level is 1.8 milliequivalents per liter. The nurse should 1. Administer the 5 p.m. dose of lithium. 2. Hold the 5 p.m. dose of lithium. 3. Give the client 8 ounces of water with the lithium. 4. Give the lithium after the client's supper. The correct answer is 2. Hold the 5 p.m. dose of lithium. Rationale: the nurse should hold the 5 p.m. dose of lithium because a level of 1.8 milliequivalents per liter can cause adverse reactions, including diarrhea, vomiting, drowsiness, muscle weakness, and lack of coordination, which are early signs of lithium toxicity. The nurse should report the lithium level to the primary healthcare provider, including any symptoms of toxicity. Administering the 5 p.m. dose of lithium, giving the client the lithium with 8 ounces of water, or giving it after supper would result in an increase of the lithium level, thus increasing the risk of lithium toxicity.
An older adult has chest pain and shortness of breath. The healthcare provider prescribes nitroglycerin tablets. What should the nurse instruct the client to do? 1. Put the tablet under the tongue until it is absorbed. 2. Swallow the tablet with 120 milliliter of water. 3. Chew the tablet until it is dissolved. 4. Place the tablet between the cheek and gums until it disappears. The correct answer is 1. Put the tablet under the tongue until it is absorbed. The client is having symptoms of a myocardial infarction. The first action is to prevent platelet formation and block prostaglandin synthesis. The client should place the tablet under the tongue and wait until it is absorbed. Nitroglycerin tablets are not effective if chewed, swallowed, or placed between the cheek and gums.
When teaching a client about self-care following placement of a new permanent pacemaker to the left upper chest, the nurse should include which information? Select all that apply. 1. Take and record daily pulse rate. 2. Avoid air travel because of airport security alarms. 3. Immobilize the affected arm for 4 to 6 weeks. 4. Avoid using a microwave oven. 5. Avoid lifting anything heavier than 3 pounds. The correct answers are 1 and 5. The nurse must teach the client how to take and record the pulse daily. The client should be instructed to avoid lifting the operative side arm above shoulder level for 1 week post-insertion. It takes up to 2 months for the incision site to heal and full range of motion to return. The client should avoid heavy lifting until approved by the physician. The pacemaker metal casing does not set off airport security alarms, so there are no travel restrictions. Prolonged immobilization is not required. Microwave ovens are safe to use and do not alter pacemaker function. Which of the following interventions is most appropriate for a client who has stomatitis? 1. Drinking hot tea at frequent intervals. 2. Gargling with antiseptic mouthwash. 3. Using an electric toothbrush. 4. Eating a soft, bland diet. The correct answer is 4. Clients with stomatitis have significant discomfort, which impacts their ability to eat and drink. They will be most comfortable eating soft, bland foods and avoiding temperature extremes in their food and liquids. Gargling with an antiseptic mouthwash will be irritating to the mucosa. Mouth care should include gentle brushing with a soft toothbrush and flossing.
A 78-year-old client is admitted to the emergency department with numbness and weakness of the left arm and slurred speech. Which nursing intervention is priority? 1. Prepare to administer recombinant tissue plasminogen activator. 2. Discuss the precipitating factors that cause the symptoms. 3. Schedule for a STAT computed tomography scan of the head. 4. Notify the speech pathologist for an emergency consult. The correct answer is 3. Schedule for a STAT computed tomography scan of the head. A CT scan will determine if the client is having a stroke or has a brain tumor or another neurological disorder. If a CVA is diagnosed, the CT scan can determine if it is a hemorrhagic or ischemic accident and guide treatment. A client with acute pancreatitis has a blood pressure of 88/40, heart rate of 128 beats per minute, respirations of 28 breaths per minute, and Gray-Turner's sign. What action should the nurse perform first? 1. Assess the urine output. 2. Place an intravenous line. 3. Position on the left side. 4. Insert a nasogastric tube. The correct answer is 2. Place an intravenous line. Gray-Turner's sign is a bluish discoloration in the flank area caused by retroperitoneal bleeding. The vital signs are showing hemodynamic instability. IV access should be obtained to provide immediate volume replacement. The urine output will provide information on the fluid status. A nasogastric tube is indicated for clients with uncontrolled nausea and vomiting or gastric distension. Repositioning the client may be considered for pain management once the client's vital signs are stable.
A nurse is helping a suspected choking victim. The nurse should perform the Heimlich maneuver when the victim 1. Starts to become cyanotic. 2. Cannot speak due to airway obstruction. 3. Can make only minimal vocal noises. 4. Is coughing vigorously. The correct answer is 2. The Heimlich maneuver should be administered only to a victim who cannot make any sounds due to airway obstruction. If the victim can whisper words or cough, some air exchange is occurring, an emergency medical system should be called instead of attempting the Heimlich maneuver. Cyanosis may accompany or follow choking. However, the Heimlich maneuver should only be initiated when the victim cannot speak.
When discussing recent onset of feelings of sadness and depression in a client with hypothyroidism, the nurse should inform the client that these feelings are 1. The effects of thyroid hormone replacement therapy will diminish over time. 2. Related to thyroid hormone replacement therapy and will not diminish over time. 3. A normal part of having a chronic illness. 4. Most likely related to low thyroid hormone levels and will improve with treatment. The correct answer is 4. Most likely related to low thyroid hormone levels and will improve with treatment. Hypothyroidism may contribute to sadness and depression. It is good practice for clients with newly diagnosed depression to be monitored for hypothyroidism by checking serum thyroid hormone and thyroid-stimulating hormone levels. This client needs to know that these feelings may be related to her low thyroid hormone levels and may improve with treatment. Replacement therapy does not cause depression. Depression may accompany chronic illness, but it is not normal.
When performing external chest compressions on an adult, during cardiopulmonary resuscitation. The rescuer should depress the sternum. 1. 0.5 inch. 2. 1 inch. 3. 1.5 inches. 4. 2 inches. The correct answer is 4. An adult sternum must be depressed 2 inches with each compression to ensure adequate heart compression. A client is given amiodarone in the emergency department for a dysrhythmia. Which of the following indicates the drug is having the desired effect? 1. The ventricular rate is increasing. 2. The absent pulse is now palpable. 3. The number of premature ventricular contractions is decreasing. 4. The fine ventricular fibrillation changes to coarse ventricular fibrillation. The correct answer is 3. Amiodarone is used for the treatment of premature ventricular contractions, ventricular tachycardia with a pulse, atrial fibrillation, and atrial flutter. Amiodarone is not used as initial therapy for a pulseless dysrhythmia. A client's diagnosis of cystic fibrosis was made 13 years ago, and she has since been hospitalized several times. On the latest admission, the client has labored respirations, fatigue, malnutrition, and failure to thrive. Which nursing actions are most important initially? 1. Placing the client on bed rest and prescribing a blood gas analysis. 2. Prescribing a high-calorie, high-protein, low-fat, vitamin-enriched diet and pancreatic granules. 3. Applying an oximeter and initiating respiratory therapy. 4. Inserting an IV line and initiating antibiotic therapy. The correct answer is 3. Clients with cystic fibrosis commonly die from respiratory problems. The mucus in the lungs is tenacious and difficult to expel, leading to lung infections and interference with oxygen and carbon dioxide exchange. The client will likely need supplemental oxygen and respiratory treatments to maintain adequate gas exchange, as identified by the oximeter reading. The child will be on bed rest due to respiratory distress. However, although blood gases will probably be prescribed, the oximeter readings will be used to determine oxygen deficit and are, therefore, more of a priority. A diet high in calories, proteins, and vitamins with pancreatic granules added to all foods ingested will increase nutrient absorption and help the malnutrition. However, this intervention is not the priority at this time. Inserting an IV to administer antibiotics is important and can be done after ensuring adequate respiratory function.
At 8 a.m., the nurse reviews the amount of T-tube drainage for a client who underwent an open cholecystectomy yesterday. After reviewing the output record, the nurse should 1. Report the 24-hour drainage amount at 12 noon. 2. Clamp the T-tube. 3. Evaluate the tube for patency. 4. Irrigate the T-tube. The correct answer is 3. Evaluate the tube for patency. The T-tube should drain approximately 300 to 500 ml in the first 24 hours, and after 3 to 4 days, the amount should decrease to less than 200 ml in 24 hours. With the sudden decrease in drainage at 8 a.m., the nurse should immediately assess the tube for obstruction of flow that can be caused by kinks in the tube or the client lying on the tube. Drainage color must also be assessed for signs of bleeding. The tube should not be irrigated or clamped without a prescription. The client diagnosed with chronic kidney disease on hemodialysis is prescribed lanthanum carbonate. Which laboratory data indicates the medication is effective? 1. A decreased serum potassium level. 2. A normal serum sodium level. 3. A decreased serum blood urea nitrogen level. 4. A normal serum phosphorus level. The correct answer is 4. A normal serum phosphorus level. Lanthanum carbonate, an electrolyte and water balancing agent, decreases phosphate absorption in the intestines, and the phosphorus is excreted in the feces. A decreased potassium level indicates the dialysis is effective, but not that the medication is effective. This medication does not affect sodium level. A decreased BUN level indicates the dialysis is effective, but not the medication.
The client is taking 50 milligrams of lamotrigine daily for bipolar depression. The client shows the nurse a rash on his arm. What should the nurse do? 1. Report the rash to the primary healthcare provider. 2. Explain that the rash is a temporary adverse effect. 3. Give the client an ice pack for his arm. 4. Question the client about recent sun exposure. The correct answer is 1. Report the rash to the primary healthcare provider. Rationale. The nurse should immediately report the rash to the primary healthcare provider because lamotrigine can cause Stevens-Johnson syndrome, a toxic epidermal necrolysis. The rash is not a temporary adverse effect. Giving the client an ice pack and questioning the client about recent sun exposure are irresponsible nursing actions because of the possible seriousness of the rash.
A client is receiving an IV infusion of heparin sodium at 1,200 units per hour. The dilution is 25,000 units per 500 milliliters. How many milliliters per hour will this client receive? The correct answer is 24 milliliters per hour. To solve this problem, first, calculate how many units are in each milliliter of the medication. The questions gives us 25,000 units per 500 milliliters. 25,000 units divided by 500 equals to 50 units. 500 milliliters divided by 500 equals to 1 milliliter. So it's 50 units per 1 milliliter. Next, calculate how many milliliters the client receives per hour. Since the client is receiving 1,200 units per hour and there is 50 units per 1 milliliter, we divide 1,200 by 50, which equals to 24. So the client is receiving 24 milliliter per hour. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
When teaching the client about complications of atrial fibrillation, the nurse should instruct the client to avoid which of the following: 1. Stasis of blood in the atria. 2. Increased cardiac output. 3. Decreased pulse rate. 4. Elevated blood pressure. The correct answer is 1. Atrial fibrillation occurs when the sinoatrial node no longer functions as the heart's pacemaker, and impulses are initiated at sites within the atria. Because conduction through the atria is disturbed, atrial contractions are reduced and stasis of blood in the atria occurs, predisposing to emboli. Some estimates predict that 30% of clients with atrial fibrillation develop emboli. Atrial fibrillation is not associated with increased cardiac output, elevated blood pressure, or decreased pulse rate. Rather, it is associated with an increased pulse rate. A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2 and 4. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code card is not needed at the bedside. The nurse is preparing to defibrillate a client on a cardiac monitor who is in ventricular fibrillation. See the photo. The nurse should do which of the following? 1. Move the paddle in the nurse's left hand to midline. 2. Move the paddle in the nurse's right hand to above the client's nipple. 3. Grasp the handles of the paddles to allow visibility of the black markings on the paddle. 4. After pressing the charge button and calling all clear, push the shock button. The correct answer is 4. The paddles are in the correct position. The nurse can push the shock button to defibrillate the client. When performing the Heimlich maneuver on a conscious adult victim, the rescuer delivers inward and upward thrusts specifically. 1. Above the umbilicus. 2. At the level of the xiphoid process. 3. Over the victim's mid-abdominal area. 4. below the xiphoid process and above the umbilicus? The correct answer is 4. The thrust should be delivered below the xiphoid process, but above the umbilicus, to minimize the risk of internal injuries. The rapid response team has been called to manage an unwitnessed cardiac arrest in a client's hospital room. The estimated maximum time a person can be without cardiopulmonary function and still not experience permanent brain damage is 1 to 2 minutes, 2, 4 to 6 minutes, 3, 8 to 10 minutes, 4, 12 to 15 minutes. The correct answer is 2. After a person is without cardiopulmonary function for 4 to 6 minutes, permanent brain damage is almost certain. To prevent permanent brain damage, it is important to begin CPR promptly after a cardiopulmonary arrest. If a client is receiving rescue breaths and the chest wall fails to rise, during cardiopulmonary resuscitation, the rescuer should first 1. Try using a bag mask device. 2. Decrease the rate of compressions. 3. Intubate the client. 4. Reposition the airway. The correct answer is 4. If the chest wall is not rising with rescue breaths, the head should be repositioned first to ensure that the airway is adequately opened. A bag mask device allows for delivery of 100% oxygen, but is difficult to manage if there is just one rescuer. Ideally, 2 persons are used to operate the bag mask device, one to maintain the seal, and the other to provide the ventilations. Compression should be maintained at 100 per minute. During cardiopulmonary resuscitation, the xiphoid process at the lower end of the sternum should not be compressed when performing cardiac compressions. Which of the following organs will be most likely at risk for laceration by forceful compressions over the xiphoid process? 1. Lung. 2. Liver. 3. Stomach. 4. Diaphragm. The correct answer is 2. Because of its location near the xiphoid process, the liver is the organ most easily damaged from pressure exerted over the xiphoid process. During CPR, the pressure on the victim's chest wall should be sufficient to compress the heart, but not so great as to damage internal organs. Injury may result, however, even when CPR is performed properly. A client who has been given cardiopulmonary resuscitation is transported by ambulance to the hospital's emergency department, where the admitting nurse quickly assesses the client's condition. The most effective way to determine the effectiveness of CPR is noting whether the 1. Pulse rate is normal. 2. Pupils are reacting to light. 3. Mucous membranes are pink. 4. Systolic blood pressure is at least 80. The correct answer is 2. Pupillary reaction is the best indication of whether oxygenated blood has been reaching the client's brain. Pupils that remain widely dilated and do not react to light probably indicate that serious brain damage has occurred. The pulse rate may be normal, mucous membranes may still be pink, and systolic blood pressure may be 80 or higher, and serious brain damage may still have occurred. A nurse teaches a client experiencing heartburn to take 1.5 ounces of Maalox when symptoms appear. How many milliliters should the client take? Blank ml. The correct answer is 45 milliliters. 1 ounce equal to 30 milliliters. You multiply 30 by 1.5. You get 45 milliliters.
Which assessment data would indicate to the nurse that the client would be at risk for a hemorrhagic stroke? 1. A blood glucose level of 480 milligrams per deciliter. 2. A right-sided carotid brute. 3. A blood pressure of 220 over 120. 4. The presence of bronchogenic carcinoma. The correct answer is 3. A blood pressure of 220 over 120. Uncontrolled hypertension is a risk factor for hemorrhagic stroke, which is a ruptured blood vessel inside the cranium. The nurse is caring for a child who has undergone a cardiac catheterization. During recovery, the nurse notices the dressing is saturated with bright red blood. The nurse's first action is to 1. Call the interventional cardiologist. 2. Notify the cardiac catheterization laboratory that the child will be returning. 3. Apply a bulky pressure dressing over the present dressing. 4. Apply direct pressure 1 inch above the puncture site. The correct answer is 4. Apply direct pressure 1 inch above the puncture site. Applying direct pressure 1 inch above the puncture site will localize pressure over the vessel site. Options 1 and 2 are not appropriate actions. Option 3 can be done after applying direct pressure 1 inch above the puncture site. A 24-year-old Gravida 2, Para 1 woman is being admitted in active labor at 39 weeks gestation. Which prenatal data would be most important for the nurse to address at this time? 1. Hemoglobin level of 11 grams per deciliter at 28 weeks gestation. 2. Positive result on test for Group B streptococci at 36 weeks gestation. 3. Urinary tract infection with Escherichia coli treated at 20 weeks gestation. 4. Elevated level on glucose screening test at 28 weeks gestation, followed by normal 3-hour glucose tolerance test results at 29 weeks gestation. The correct answer is 2. Positive result on test for Group B streptococci at 36 weeks gestation. The positive Group B streptococci result requires immediate action. The healthcare provider must be notified, and orders obtained for prompt antibiotic prophylaxis during labor to reduce the risk of mother-to-newborn transmission of Group B streptococci. The other data are not as significant in the care of the patient at this moment. Intrapartum appropriate antibiotic treatment of the mother with Group B streptococci supports the perinatal core measure of reducing healthcare-acquired bloodstream infections in newborns. Propylthuracil is prescribed for a client with Graves' disease. The nurse should teach the client to immediately report which of the following? 1. Sore throat. 2. Painful excessive menstruation. 3. Constipation. 4. Increased urine output. The correct answer is 1. Sore throat. The most serious adverse effects of PTU are leukopenia and agranulocytosis, which usually occur within the first 3 months of treatment. The client should be taught to promptly report to the healthcare provider signs and symptoms of infection, such as a sore throat and fever. Clients having a sore throat and fever should have an immediate white blood cell count and differential performed, and the drug must be withheld until the results are obtained. Painful menstruation, constipation, and increased urine output are not associated with PTU therapy.
A 12-year-old with asthma wants exercise. Which of the following activities should the nurse suggest to improve breathing? 1. Soccer. 2. Swimming. 3. Track. 4. Gymnastics. The correct answer is 2. Swimming is appropriate for this child because it requires controlled breathing, assists in maintaining cardiac health, enhances skeletal muscle strength, and promotes ventilation and perfusion. Stop and start activities, such as soccer, track, and gymnastics, commonly trigger symptoms in asthmatic clients.
A client has undergone a laparoscopic cholecystectomy. Which of the following instructions should the nurse include in the discharge teaching? 1. Empty the bile bag daily. 2. Breathe deeply into a paper bag when nauseated. 3. Keep adhesive dressings in place for 6 weeks. 4. Report bile-colored drainage from any incision. The correct answer is 4. Report bile-colored drainage from any incision. There should be no bile-colored drainage coming from any of the incisions post-operatively. A laparoscopic cholecystectomy does not involve a bile bag. Breathing deeply into a paper bag will prevent a person from passing out due to hyperventilation. It does not alleviate nausea. If the adhesive dressings have not already fallen off, they are removed by the surgeon in 7 to 10 days, not 6 weeks. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The monitor technician informs the nurse that the client has started having premature ventricular contractions every other beat, which is a priority in nursing action. 1. Activate the rapid response team. 2. Assess the client's orientation and vital signs. 3. Call the physician. 4. Administer a bolus of lidocaine. The correct answer is 2. The priority action is to assess the client and determine whether the rhythm is life-threatening. More information, including vital signs, should be obtained, and the physician should be quickly notified. A bolus of lidocaine may be prescribed to treat this arrhythmia. This is not a code-type situation unless the client has been determined to be in a life-threatening situation.
The client who has been hospitalized with pancreatitis does not drink alcohol because of her religious convictions. She becomes upset when the physician persists in asking her about alcohol intake. The nurse should explain that the reason for these questions is that 1. There is a strong link between alcohol use and acute pancreatitis. 2. Alcohol intake can interfere with the tests used to diagnose pancreatitis. 3. Alcoholism is a major health problem, and all clients are questioned about alcohol intake. 4. The physician must obtain the pertinent facts, regardless of religious beliefs. The correct answer is 1. There is a strong link between alcohol use and acute pancreatitis. Alcoholism is a major cause of acute pancreatitis in the United States and Canada. Because some clients are reluctant to discuss alcohol use, staff may inquire about it in several ways. Generally, alcohol intake does not interfere with the tests used to diagnose pancreatitis. Recent ingestion of large amounts of alcohol, however, may cause an increased serum amylase level. Large amounts of ethyl and methyl alcohol may produce an elevated urinary amylase concentration. All clients are asked about alcohol and drug use on hospital admission, but this information is especially pertinent for clients with pancreatitis. Physicians do need to seek facts, but this can be done while respecting the client's religious beliefs. Respecting religious beliefs is important in providing holistic client care. After a client who has had a laparoscopic cholecystectomy receives discharge instructions, which of the following client statements would indicate that the teaching has been successful? Select all that apply. 1. I can resume my normal diet when I want. 2. I need to avoid driving for about 4 weeks. 3. I may experience some pain in my right shoulder. 4. I should spend 2 to 3 days in bed before resuming activity. 5. I can take a shower 2 days later. The correct answers are 1. I can resume my normal diet when I want. 3. I may experience some pain in my right shoulder. And 5. I can take a shower 2 days later. Following a laparoscopic cholecystectomy, the client can resume a normal diet as tolerated. The client may experience right shoulder pain from the gas that was used to inflate the abdomen during surgery. The puncture site should be cleansed daily with mild soap and water. If a Band-Aid was applied after surgery, it can be patted dry or removed and replaced. Driving can usually be resumed in 3 to 4 days following surgery, and there is no need for the client to maintain bed rest in the days following surgery. Light exercise such as walking can be resumed immediately. A client undergoes a laparoscopic cholecystectomy. Which of the following dietary instructions should the nurse give the client immediately after surgery? 1. You cannot eat or drink anything for 24 hours. 2. You may resume your normal diet the day after your surgery. 3. Drink liquids today and eat lightly for a few days. 4. You can progress from a liquid to a bland diet as tolerated. The correct answer is 3. Drink liquids today and eat lightly for a few days. Immediately after surgery, the client will drink liquids. A light diet can be resumed the day after surgery. There is no need for the client to remain on nothing by mouth status after surgery because peristaltic bowel activity should not be affected. The client will probably not be able to tolerate a full meal comfortably the day after surgery. There is no need for the client to stay on a bland diet after a laparoscopic cholecystectomy. The client should, however, avoid excessive fats. A client with cholecystitis continues to have severe right upper quadrant pain. The nurse obtains the following vital signs: temperature 38.4 degrees Celsius, pulse 114, respirations 22, blood pressure 142/90. Using the S-bar technique for communication, The nurse recommends to the primary care provider for the client to receive 1. Hydromorphone IV 2. Dultiazem PO 3. Meperidine IM 4. Promethazine IM. The correct answer is 1. Hydromorphone IV. Hydromorphone should be considered for pain management. It should be administered intravenously for rapid action to address the severe pain the client is experiencing. Intramuscular injections are painful and slower acting. Since meperidine's toxic metabolite can cause seizures, it is no longer the treatment choice for pain. Dultiazem, a calcium channel blocker, is not indicated. Elevation of heart rate and blood pressure is likely due to pain and fever. Promethazine is used to treat nausea. The nurse is caring for a client who had an open cholecystectomy 24 hours ago. The client's vital signs have been stable over the last 24 hours, with most recent temperature 37 degrees Celsius, blood pressure 118/76, respiratory rate 16 breaths per minute, and heart rate 78 beats per minute, but are now changing. Which of the following indicate that the nurse should contact the physician? 1. Temperature 38.8 degrees Celsius, blood pressure 140/86, heart rate 94 beats per minute, respiratory rate 24 breaths per minute. 2. Temperature 38.2 degrees Celsius, blood pressure 118/68, heart rate 84 beats per minute, respiratory rate 20 breaths per minute. 3. Temperature 37.5 degrees Celsius, blood pressure 126/80, heart rate 58 beats per minute, respiratory rate 16 breaths per minute. 4. Temperature 36.4 degrees Celsius, blood pressure 98/64, heart rate 98 beats per minute, respiratory rate 18 breaths per minute. The correct answer is 1. Temperature 38.8 degrees Celsius, blood pressure 140/86, heart rate 94 beats per minute, respiratory rate 24 breaths per minute. This client is exhibiting 3 of 4 signs of systemic inflammatory response syndrome: temperature greater than 38 degrees Celsius or less than 36 degrees Celsius, heart rate greater than 90 beats per minute, respiratory rate greater than 20 breaths per minute. The fourth indicator is an abnormal white blood cell count, greater than 12,000, less than 4,000, or greater than 10% bands. At least 2 of these variables are required to define systemic inflammatory response syndrome. The nurse in the long-term care facility is caring for a client with an indwelling catheter. Which preparation should the nurse order for the client? 1. Cranberry juice with breakfast daily. 2. Nitrofurantoin, 100 milligrams every 12 hours for 7 days. 3. Vitamin C every night at bedtime. 4. Golden Seal 2 milliliters in water, 2 to 3 times daily. The correct answer is 1. Cranberry juice with breakfast daily. Cranberry juice is acidic and will change the pH of the urine, making it harder for bacteria to survive in the environment. It can be used prophylactically to prevent UTIs. It does not treat an infection. The nurse can arrange with the dietitian to include this in the client's dietary plan. Nitrofurantoin, a sulfa drug, is a prescription medication that is used to treat chronic UTIs, but the nurse could not order this medication. In a long-term care facility, over-the-counter vitamin C would require an HCP order. Golden Seal is an herb used for UTIs, but in a long-term care facility, it would require an HCP order.
A nurse is conducting a psychoeducational group for family members of clients hospitalized with depression. Which family member's statement indicates a need for additional teaching? 1. My husband will slowly feel better as his medicine takes effect over the next 2 to 4 weeks. 2. My wife will need to take her antidepressant medicine and go to group to stay well. 3. My son will only need to attend outpatient appointments when he starts to feel depressed again. 4. My mother might need help with grocery shopping, cooking, and cleaning for a while. The correct answer is 3. My son will only need to attend outpatient appointments when he starts to feel depressed again. Rationale. Additional teaching is needed for the family member who states her son will only need to attend outpatient appointments when he starts to feel depressed again. Compliance with medication and outpatient follow-up are key in preventing relapse and rehospitalization. The statements expressing expectations of feeling better as medication takes effect, needing medicine and group therapy to stay well, and needing help with grocery shopping, cooking, and cleaning for a while indicate the family's understanding of depression, medication, and follow-up care.
The nurse has completed an assessment of a client with a decreased cardiac output. Which findings should receive the highest priority? 1. BP 110/62, atrial fibrillation with heart rate 82, bibasilar crackles. 2. Confusion, urine output 15 milliliter over the last 2 hours, orthopnea. 3. Oxygen saturation 92% on 2 liters via nasal cannula, respirations 20, 1 plus edema of lower extremities. 4. Weight gain of 1 kilogram in 3 days, BP 130/80, mild dyspnea with exercise. The correct answer is 2. Confusion, urine output 15 milliliter over the last 2 hours, orthopnea. A low urine output and confusion are signs of decreased tissue perfusion. Orthopnea is a sign of left-sided heart failure. Crackles, edema, and weight gain should be monitored closely, but the levels are not as high a priority. With atrial fibrillation, there is a loss of atrial kick, but the blood pressure and heart rate are stable.
A client has been admitted to the coronary care unit. The nurse observes third-degree heart block at a rate of 35 beats per minute on the client's cardiac monitor. The client has a blood pressure of 90/60. The nurse should take which of the following actions first? 1. Prepare for transcutaneous pacing. 2. Prepare to defibrillate the client at 200 joules. 3. Administer an IV lidocaine infusion. 4. Schedule the operating room for insertion of a permanent pacemaker. The correct answer is 1. Transcutaneous pacemaker therapy provides an adequate heart rate to a client in an emergency situation. Defibrillation and a lidocaine infusion are not indicated for the treatment of third-degree heart block. Transcutaneous pacing is used temporarily until a transvenous or permanent pacemaker can be inserted. A client who has a history of a mitral valve prolapse is scheduled to get her teeth cleaned. Which of the following replies by the nurse is most appropriate? 1. The physician will need to reevaluate the status of your heart condition before your dental appointment. 2. Be sure to remind your dentist that you have a heart condition. 3. It is important for you to care for your teeth because your heart condition makes you more susceptible to developing oral infections. 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. The correct answer is 4. Clients who are at risk for developing infective endocarditis due to cardiac conditions such as mitral valve prolapse must take prophylactic antibiotics before any dental procedure that may cause bleeding. The client is not more susceptible to developing oral infections. Rather, the client is more susceptible to developing endocarditis that results from oral bacteria that enter the circulation during the dental procedure. The physician does not necessarily need to reevaluate the heart condition of a client who is stable, but antibiotics must be prescribed. It is not enough to simply remind the dentist about the heart condition.
The nurse is assessing a client experiencing motor loss as a result of a left-sided cerebrovascular accident. Which clinical manifestations would the nurse document? 1. Hemiparesis of the client's left arm and apraxia. 2. Paralysis of the right side of the body and ataxia. 3. Homonymous hemianopsia and diplopia. 4. Impulsive behavior and hostility toward family. The correct answer is 2. Paralysis of the right side of the body and ataxia. The most common motor dysfunction of a CVA is paralysis of one side of the body, hemiplegia. In this case, with a left-sided CVA, the paralysis would affect the right side. Ataxia is an impaired ability to coordinate movement. A client is admitted with acute necrotizing pancreatitis. Lab results have been obtained, and a peripheral IV has been inserted. Which of the following prescriptions from a healthcare provider should the nurse question? 1. Infuse a 500 ml normal saline bolus. 2. Calcium gluconate 90 mg in 100 ml normal saline. 3. Total parenteral nutrition at 72 ml per hour. 4. Placement of a Foley catheter. The correct answer is 3. Total parenteral nutrition at 72 ml per hour. Clients with acute necrotizing pancreatitis should remain nothing by mouth with early enteral feeding via the jejunum to maintain bowel integrity and immune function. TPN is considered if enteral feedings are contraindicated. Access is also needed for TPN, preferably via a central line. Hemodynamic instability can result from fluid volume loss and bleeding and requires fluid and electrolyte replacement. Fat necrosis occurring with acute pancreatitis can cause hypocalcemia requiring calcium replacement. A Foley catheter provides accurate output assessment to monitor for prerenal acute renal failure that can occur from hypovolemia. The nurse monitors the client with pancreatitis for early signs of shock. Which of the following conditions is primarily responsible for making it difficult to manage shock in pancreatitis? 1. Severity of intestinal hemorrhage. 2. Vasodilating effects of kinin peptides. 3. Tendency toward heart failure. 4. Frequent incidence of acute tubular necrosis. The correct answer is 2. Vasodilating effects of kinin peptides. Life-threatening shock is a potential complication of pancreatitis. Kinin peptides activated by the trap trypsin cause vasodilation and increased capillary permeability. These effects exacerbate shock and are not easily reversed with pharmacologic agents such as vasopressors. Hemorrhage may occur into the pancreas, but not in the intestines. Systemic complications include pulmonary complications, but not heart failure or acute tubular necrosis. A client has been admitted to the medical surgical unit following an emergency cholecystectomy. There is a Jackson Pratt drain with a portable suction unit attached. After 4 hours, the drainage unit is full. The nurse should do which of the following? 1. Notify the surgeon. 2. Remove the drain and suction unit. 3. Check the dressing for bleeding. 4. Empty the drainage unit. The correct answer is 4. Empty the drainage unit. Portable suction units should be emptied and drained every shift or when full. It is normal for the unit to fill within the first hours after surgery. The nurse does not need to contact the surgeon. There should not be bleeding on the dressing if the drainage system is emptied when full. The drain should not be removed until prescribed by the physician. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following discharge instructions would be appropriate for a client who has had a laparoscopic cholecystectomy and has sutures covered by steri-strips? 1. Avoid showering for 1 week after surgery. 2. Return to work within 1 week. 3. Leave steri-strips in place until you see the surgeon at the post-operative visit. 4. Use acetaminophen to control any fever. The correct answer is 3. Leave steri-strips in place until you see the surgeon at the post-operative visit. After a laparoscopic cholecystectomy, when there are sutures covered by a dressing or steri-strips, the client should not remove dressings from the puncture sites, but should wait until visiting the surgeon. The client may shower 48 hours after surgery. A client can return to work within 1 week, but only if approved by the surgeon and no strenuous activity is involved. The client should report any fever, which could be an indication of a complication. The nurse prepares to administer promethazine 35 mg IM as prescribed PRN for a client with cholecystitis who has nausea. The ampule label reads that the medication is available in 25 mg per ml. How many milliliters should the nurse administer? To solve this problem, you set up the formula as 35 mg over X equals to 25 mg over 1 milliliter. You cross-multiply 35 times 1 and X times 25. You get 25X equals to 35. You divide 25 on both sides, and you get X equals to 1.4 milliliters. After a cholecystectomy, the client is to follow a low-fat diet. Which of the following foods would be most appropriate to include in a low-fat diet? 1. Cheese omelet. 2. Peanut butter. 3. Ham salad sandwich. 4. Roast beef. The correct answer is 4. Roast beef. Lean meats, such as beef, lamb, veal, and well-trimmed lean ham and pork, are low in fat. Rice, pasta, and vegetables are low in fat when not served with butter, cream, or sauces. Fruits are low in fat. The amount of fat allowed in a client's diet after a cholecystectomy will depend on the client's ability to tolerate fat. Typically, the client does not require a special diet, but is encouraged to avoid excessive fat intake. A cheese omelet and peanut butter have high fat content. Ham salad is high in fat from the fat in salad dressing. The male client is admitted to the medical floor with a diagnosis of pyelonephritis. Which intervention should the nurse implement first? 1. Initiate IV access with a 20-gauge catheter. 2. Administer the IV antibiotic within 2 hours of admission. 3. Obtain a urine specimen for culture and sensitivity. 4. Notify the dietary department to order the client a regular diet. The correct answer is 3. Obtain a urine specimen for culture and sensitivity. The nurse should obtain a clean voided midstream specimen for culture and sensitivity before initiating the antibiotics. This is the first intervention to implement. The IV is important to initiate therapy, but the nurse should obtain a clean voided midstream urine for culture and sensitivity before initiating the treatment. If the culture is not obtained prior to initiating the antibiotic, the results of the laboratory test will be skewed. A diet order is not a priority over getting the treatment started. UTIs in males are difficult to treat and can be life-threatening. Indomethacin may be given to close which congenital heart defect in newborns? Blank. The correct answer is patent ductus arteriosus. Prostaglandins allow the duct to remain open. Thus, a prostaglandin inhibitor, such as indomethacin or ibuprofen, can help close the duct. The nurse identified late fetal heart decelerations and decreased variability in the fetal heart rate of a woman in active labor and notified the healthcare provider on call, who advised the nurse that the pattern is acceptable. What would be the priority action at this time? 1. Advise the patient that a different HCP will be called because the first HCP's response was not adequate. 2. Discuss the concerns with another labor and delivery nurse. 3. Document the conversation with the HCP accurately, including the HCP's interpretation and recommendation, and continue close observation of the fetal heart rate. 4. Go up the chain of command and communicate the assessment of the fetal heart rate findings clearly to the next appropriate person per unit protocol. The correct answer is 4. Go up the chain of command and communicate the assessment of the fetal heart rate findings clearly to the next appropriate person per unit protocol. The nurse must follow through on the findings of a non-reassuring fetal heart rate. When patient safety is concerned, the nurse is obligated to pursue an appropriate response. Documenting the conversation with the HCP and discussing it with a colleague are appropriate, but something must be done to address the immediate safety concern and possible need for intervention at this time. The nurse must persist until the safety concern has been addressed appropriately. The nurse is evaluating a client with hyperthyroidism who is taking propylthuracil 100 mg per day in 3 divided doses for maintenance therapy. Which of the following statements from the client indicates the desired outcome of the drug? 1. I have excess energy throughout the day. 2. I am able to sleep and rest at night. 3. I have lost weight since taking this medication. 4. I do perspire throughout the entire day. The correct answer is 2. I am able to sleep and rest at night. PTU is a prototype of thioamide antithyroid drugs. It inhibits production of thyroid hormones and peripheral conversion of T4 to the more active T3. A client taking this antithyroid drug should be able to sleep and rest well at night, since the level of thyroid hormones is reduced in the blood. Excess energy throughout the day, loss of weight, and perspiring through the day are symptoms of hyperthyroidism, indicating the drug has not produced its outcome.
Which assessment findings should lead the nurse to suspect that a toddler is experiencing respiratory distress? Select all that apply. 1. Coughing. 2. Respiratory rate of 35 breaths per minute. 3. Heart rate of 95 beats per minute. 4. Restlessness. 5. Malaise. 6. Diaphoresis. The correct answers are 1, 2, 4, 6. Coughing, especially at night and in the absence of an infection, is a common symptom of asthma. Early signs of respiratory distress include restlessness, tachypnea, tachycardia, and diaphoresis. Other signs also include hypertension, nasal flaring, grunting, wheezing, and intercostal retractions. A heart rate of 95 beats per minute is normal for a toddler. Malaise typically does not indicate respiratory distress.
A 40-year-old client is admitted to the hospital with a diagnosis of acute cholecystitis. The nurse should contact the physician to question which of the following prescriptions? 1. IV fluid therapy of normal saline solution to be infused at 100 ml per hour until further prescriptions. 2. Administer morphine sulfate 10 mg IM every 4 hours as needed for severe abdominal pain. 3. Nothing by mouth until further prescriptions. 4. Insert a nasogastric tube and connect to low intermittent suction. The correct answer is 2. Administer morphine sulfate 10 mg IM every 4 hours as needed for severe abdominal pain. A nurse should question the prescription for morphine sulfate because it is believed to cause biliary spasm. Thus, the preferred opioid analgesic to treat cholecystitis is meperidine. Elderly clients should not be given meperidine because of the risk of acute confusion and seizures in this population. An alternative pain medication will be necessary. IV fluid therapy is used to maintain fluid and electrolyte balance that may result from NPO status and gastric suctioning. NPO status and gastric decompression prevent further gallbladder stimulation. The client diagnosed with chronic kidney disease is prescribed apoetin. Which statement best describes the scientific rationale for administering this medication? 1. This medication stimulates red blood cell production. 2. This medication stimulates white blood cell production. 3. This medication is used to treat thrombocytopenia. 4. This medication increases the production of urine. The correct answer is 1. This medication stimulates red blood cell production. Apoetin, a biologic response modifier, is a glycoprotein produced by the kidney that stimulates red blood cell production in response to hypoxia. It is prescribed to treat the anemia that occurs in clients diagnosed with CKD. Filgrastim is the biological response modifier that stimulates WBCs and is not used in the treatment of CKD. Oprelvekin is the biological response modifier that stimulates megakaryocyte and thrombocyte production, which stimulates platelet production to prevent thrombocytopenia in clients receiving chemotherapy. There is no medication that increases the production of urine. Diuretics increase the excretion of urine, but do not affect the production of urine. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.